Here, and thanks, Anna, for the introduction. On behalf of the Drexel Research Center on Extreme Weather Events and Urban Health, I'm delighted to open the Pre-Symposium and the first session. And as Anna already alluded to, we have two objectives today. So the first is to highlight the innovative data and methods that can be used to advance research on climate change impacts in urban environments. And the second objective is to discuss how these tools can be leveraged across complex interdisciplinary research questions. And again, as Anna already mentioned, cities are at the forefront of climate change because they are hotspots of vulnerability and adaptation at the same time. There's so many air pollution, flooding, and extreme weather events that concentrate in cities, but there are also a lot of talented people and researchers who do the work to improve the well-being of the cities. And so to move forward with improving our health, we need to integrate data, bridge disciplines, and use new approaches. And today's first session will showcase this. So we'll hear 4 different perspectives that discuss key concepts for urban climate and health research, bring in measurements to explore inequities, discuss health outcomes, and conclude with new research directions. I should also say that it was really nice to see talks by most of the speakers at ICC in Atlanta a couple of weeks ago. So before we start, there's a couple of housekeeping items. So each speaker will have 15 minutes. There will be a timekeeper to assist with keeping the time. Yeah, it's right there in the back. So what we aim for is to have about 25 to 30 minutes left at the end of the talks for discussion. But if the speaker concludes their talk within less than 15 minutes, then we can have time for maybe 1 or 2 very brief questions. Another thing I should mention is that there will also be availability to ask questions on Zoom. So those who are joining on Zoom are welcome to submit their questions via chat, and we'll be monitoring that. And then the last thing is that after the session, in-person visitors, guests, attendees can enjoy some coffee and refreshments in the lobby. And then those who are on Zoom can just stay tuned for the next session that will start at 10:45. So with that, let me introduce our first speaker. So our first speaker today will be Dr. Joan Casey, who is an associate professor of environmental and occupational health at the University of Washington. And Dr. Casey uses large secondary spatial data sources to investigate the health impacts of a range of emerging environmental exposures and prioritizes the study of joint social and environmental risk factors that explain persistent health disparities. And so with that, please join me in welcoming Dr. Casey.
Hi, everyone. Thank you to the organizers. Really lovely to be here with you all in person, and hi to everyone on Zoom. I will get started. So I got invited to this. I couldn't help but wonder. Our city is special. What is a neighborhood anyway? Should we use different data? Are there city-specific climate and health considerations? So I'm going to try to talk about some of those today. So I'll start talking broadly about neighborhoods. I'm going to talk about data in the city and the considerations around hyper-local data that we might want to leverage in our urban environments. And then I'm going to talk a little bit about some recent work on the LA fires. Okay, my animation isn't working. So that is cool. We are having a Mac to PC situation. So that's fine. You'll see things up front. Sorry, everyone. Okay, so neighborhoods. Turn to your neighbor. Tell them which neighborhood you live in. Please, really, out loud. Okay. Like it's fine. Great. There's a lot to say about the neighborhood. Not to my street. Conversation. Okay, so then if I asked you to tell your neighbor about your census tract, you probably don't have much to say, right? So I live in Seattle. I live in this area circled in purple, Magnolia. I had to Google what census tract I lived in. I've never thought about it. I never told anyone what it was. So Dr. Diaz-Rue has been saying this since, I don't know, the early 2000s, but administrative boundaries are not neighborhoods. So this is something for us to think about when we're studying climate and health and considering community. In environmental epi, I think critically also environmental exposures do not know administrative boundaries, do not know neighborhoods. Wildfire smoke drifts freely across these boundaries, and we want to start thinking about this as we're identifying exposures that people experience, especially when they're also traveling throughout the city. So we also see these emergent properties of neighborhoods. I want to just talk about this a little bit in the case of racial segregation. So we can think about segregation as a spatial form of social inequality, and it can range from kind of next door neighbor metrics, where you're talking about, do people live next door to someone of the same race or ethnicity as them, all the way up to properties that only exist at a much higher level of aggregation, like across a city or a county. So something like the dissimilarity index, where we're talking about, do neighborhoods within the city match the racial composition of the overall metro area or county as a whole? And so we can't define a dissimilarity index at an individual level. It's a construct that only exists at a higher level of aggregation. These are some maps from segregation in the United States in 1940 that we've been working on to link to late life health. And you can see, depending on how we define segregation, at which unit, using which data, using door-to-door neighbor data from the census on the left-hand side, we can see a really different pattern of segregation, where red represents the most segregated areas in the entire United States on both of these maps. But you're seeing kind of opposite interpretations and take-home messages around what segregation looked like in the US at this time. So we have to think about how we're defining these variables and how these properties merge. I want to talk about very briefly two types of contextual variables that we think about. So we think about these derived variables. This is where we're just summarizing individual characteristics. So we're taking everyone's air pollution exposure in a census tract, and we're taking the average of that, and that's what we're assigning to the census tract. There can also be these variables that I'm mentioning that don't really have an individual level analog. So we are putting into place a policy at the county level to protect people from wildfire smoke. It doesn't really exist at the individual level. I think about this with work I do on power outages. My house can be without power, and that could affect my health. Maybe I can't run air conditioning and I can't run air filtration. But if the entire city is without power, it's an entirely different exposure, right? The services break down, there's no public transit, I might not be able to get to a hospital. And so thinking about, in the context of climate change, both individual level and area level ways in which these exposures can affect health. So cities are unique because we can see these block-to-block changes in exposures, in composition, in health outcomes. And so thinking about the use of hyperlocal data in cities is something we have worked on. Let's say we're interested in traffic-related air pollution and health. So this is the Bay Area. There are these 4 US EPA NO2 monitors. We could use these to estimate traffic-related air pollution. We also can use Google Street View cars and drive up and down every single block, like Josh Apte's group at Berkeley did, to try to characterize changes in exposure block to block. And if we're going to study, for example, as we did, the relationship between traffic-related air pollution and maternal health in West Oakland, we could use this single site monitor. We could estimate a distance to a roadway, but we might be missing a lot of variation within blocks. So if we zoom in here, instead of using a single site monitor, we could take these Google Street View cars and we could drive a lot. Thousands and thousands of trips up and down these blocks, cataloging over 20,000 miles through West Oakland. and get some much more finely resolved data where we actually see, you can see within a block here, big variation of parts per billion of NO that actually pop up, and there's actually a laundry facility located here that's emitting a lot of NO. And so at the end of the day, this is a relatively small area. You can see it's kind of a 3 kilometer by 3 kilometer space. We actually have a lot of heterogeneity in exposure within West Oakland. And so we were able to work with Sutter Health. Sorry, there's no animations, giving you a lot of information at once. We were able to work with Sutter Health and look at the relationship with preeclampsia in this area. And we were interested in particular because there are big racial disparities in preeclampsia. You can see the non-Hispanic Black population here has about double the prevalence of preeclampsia. And we were interested working with Dana Goen, who is now an assistant professor at Columbia, whether if we did this hypothetical intervention of reducing air pollutants to their 25th percentile in West Oakland, whether we could reduce the risk of preeclampsia and whether this risk would differ by maternal race as a proxy for things like individual and systemic racism. And so what we did see was for Black birthing persons in West Oakland, when we reduced air pollution, we did see this benefit for preeclampsia risk. And these are all people living within, 3 kilometers of one another. We're still able to pick up this difference in exposure tied to health. Some other hyperlocal data. So we, in New York City, have thousands of people living in a single building. And so we can actually start using building to building data. So this is work led by Nina Flores, who's now a postdoc at UT Austin and just finished her PhD at Columbia. New York City has NYC 311. You can call in complaints for things like my power being out, there's mold in my building, my landlord is not doing something they need to do. But NYCHA, which is public housing, where thousands of New Yorkers live, the biggest public housing development in America, is exempted from 311. So folks living there cannot use this service. NYCHA has their own maintenance complaint system, which, as you can expect, it's a public agency, is quite backlogged. It can take months for people to respond to these complaints. But NYCHA and HUD reached an agreement, and in 2019, NYCHA started having to push every complaint to an online, publicly available reporting system. And this included things like electricity outages, elevator outages, heat, gas, hot water, and water outages. And so we now have information on how many at the time where these events took place, how many residents were affected, where they were in the city. So this is a great interface, but not very usable, not downloadable. So Nina actually created her own dashboard where people can go on and filter to specific developments, download CSV files of whatever they're interested in, and start to actually catalog. You can see there's thousands and thousands of entries here. And so she published this paper just this year. You can see the frequency of these different types of outages in New York City public housing. A lot of them are elevator outages, but the durations are shown here on the far right. So the light purple are electric outages. And so outages lasting, over 20 hours. That's a pretty long time for a median outage. And that means many of these buildings, because they're very tall, also elevators aren't working. People are having to walk up with children, older adults. And we're interested in whether these outages co-occurred with extreme weather, which could really amplify their impacts. And so she also created this plot development by development of outages. So we're looking at electric outages that occurred with extreme heat, elevator outages with extreme heat, and heat outages with extreme cold, and the total years of this overlap occurring in each of these developments. And so now this information can be downloaded row by row. So I think this is the type of thing that can be really useful. And in her preliminary analyses, looking at the building level, we are seeing a relationship between these outages and asthma exacerbations in New York City. Okay, let me finish up with the LA fires. Folks are familiar with this. LA fires, January 7th, 2025. Palisades and Eaton fires ignite, followed by other fires in LA County and Ventura County nearby, ultimately burning about 40,000 acres, nearly 20,000 structures. This recent study in JAMA estimated 440 deaths attributable to this event. There's a few mechanisms through which I think these fires are impacting or did impact health. The first being poor air quality. So in orange, you're looking at the EPA monitors existing in LA County. And you can see those are the monitors where we see spikes in fine particulate matters during the fire, several days over the EPA 24-hour standard of 35 micrograms per meter cubed. But there's other exposures that I think are really critical and sometimes overlooked. So another one is evacuation, really stressful events. These are the evacuation boundaries from the LA fires. So people are having to leave their homes, potentially leaving behind medications, not having access to medical devices, experiencing stressful events. Our group has seen elevated risk of motor vehicle crashes during evacuations. And there's also just tremendous psychosocial stress. This was in the news. LA County schools were shut down for an entire week. And so this is another layer of what's going on during this climate disaster. So we're interested in finding out whether healthcare utilization changed during the week following the fire ignition. And so we partnered with Kaiser Permanente in Southern California. We were able to look at outpatient visits and virtual care visits, which often haven't been looked at in the context of climate change, but we'll see potentially are quite important. To assign exposure, we did something pretty simple because we wanted to do this quickly. We took Kaiser's entire population, we linked them to their census tracts, and we said if their census tract was within 20 kilometers of a fire boundary, they were highly exposed. If they were in LA County but farther than 20 kilometers, moderately exposed, and everyone else in the Kaiser catchment area was called minimally exposed. We thought LA was special because of just how disrupted communities were there. So we had daily data on all-cause cardiovascular injury, neuropsychiatric, and respiratory visits. We had data from November to January 2022 to 2025. And we assessed this relationship using a two-stage interrupted time series model. So basically what we did was we took the pre-period data, which would be those black dots before the red line. We tried to fit a model for each of these outcomes to best fit the trend in visits. Then we stopped. When the fire happened, we projected forward what we would have expected the visits to look like. And then we compared, so that would be that green dash line. And then we compared what we actually saw, those black dots after the fire, to what we would have expected based on our model. So any difference between those two, we would attribute to the fire itself. So what did we see? Elevated visits. So outpatient visits, we saw about a 30% increase in respiratory visits, both in the highly and moderately exposed group in that week following fire ignition. We're not going to see the virtual visits because that's not looking good. Okay. Imagine on the right that you saw virtual visits and they're about 40% elevated for both cardiovascular and respiratory visits. And then we also saw for injury and neuropsych visits elevations. For these, it was more concentrated towards the beginning of the fire. So on that first day, we saw increases in outpatient injury visits, neuropsych visits. If you were seeing the virtual visits on the right, you would
also see increased elevation across the having a fun
problems in the room. Okay, and you would also see increases in injury kind of across that first week, about a 20% elevation. So we then applied these estimates to all insured LA County residents, and at the end of the day, we estimated about 16,000 excess virtual cardiovascular visits, 18,000 excess virtual respiratory visits, and nearly 28,000 excess respiratory outpatient care visits over just this week period after the fires first ignited. So important to note that virtual care might be becoming increasingly important during these climate events where providers can't get to the clinic, where people cannot travel there or don't feel safe going out of their homes to go to a health care center. So something for us to consider going forward. In terms of some next steps, we have these hyperlocal data in Los Angeles. So we have home by home actual images of where homes burned, and we can link that to Kaiser Permanente member addresses. We can look at their health over time over a much longer time period, because the week after certainly is not when the effects of this exposure will stop. We also need to think about resiliency planning in the context of health and health equity. So this is just thinking about how having solar and storage can be pretty protective of health during climate events when the power might go out, so we can keep things running. And this is work by Elena Krieger that's shown in California, a pretty disproportionate uptake of solar in wealthy communities in California. So this is Callan Byers screen score. At the bottom are the most disadvantaged communities in California, and you can see much smaller uptake of solar, and also this trajectory of outside disadvantaged communities seeing this much steeper slope of uptake of solar. This is in California where there are big pushes to have uptake of solar in disadvantaged communities. So this is kind of the best case scenario, unfortunately. But there's some hope. There's some very cool projects happening. This is Together New Orleans. They're putting in what they're calling lighthouses in New Orleans. These are churches and other public buildings with solar and storage. Each one of these has a nurse assigned to it with community members, and the idea is everyone lives within 800 meters of one of these lighthouses. So people have a place to go, people to check on them during climate disasters. So with that, I will wrap up, say thank you very much to many students and collaborators on this, and to NIH. So thank you very much for your time.
Thank you so much. So let's, muting this one, and then we're gonna ask. I'm not. Here. Hopefully everything will be working now. No. You. Wait. Should I try now? Muted. It should be muted there. Let's see. No, it's still not great, right? Good. Hi, everyone. So let's welcome our next speaker, Dr. Gage Kerr. So Dr. Kerr will take us from space to the streets.
Okay, it's working. So now we will welcome Dr. Gage Kerr, who will take us from space to the streets, showing how satellite data can provide new insights into urban air quality, health, and equity. Dr. Kerr is an assistant research professor and professional lecturer in the Department of Environmental and Occupational Health at the Milken Institute of Public Health at George Washington University. And he researches the drivers and impacts of ambient air pollution with an emphasis on understanding associated disease burdens and disparities. Join me in welcome Dr. Kerr.
Thank you for the introduction and for the invite to be here. I'm really excited to be with you all in person for those who are online. I'll jump right in, and I just want to start out by acknowledging some collaborators who made this research possible. And it's okay, I'll hide this panel. Yeah. Great. So just wanted to give a shout out to some of the folks that enabled the research I'll be presenting on today. And in order to set the stage for what I'll be talking about, I want to return to that old anecdote that a picture is worth 1,000 words. So the image that you see on the left is taken from the Detroit Historical Society and shows a neighborhood in Detroit called Black Bottom. It might be hard to see from the back of the room, but if you were to get closer or if you were to zoom in, you could see people walking on the streets. There are lots of storefronts with residential units above them. There are cars driving around. It looks pretty nice, right? If we fast forward just a few years, we see that all of that kind of built environment has been erased to pave the way for what I believe is I-375. If there are any Michiganders in the room, you can fact check me. But this type of urban planning was not unique to just Detroit. And if we look at urban environments across the country, we see similar stories. I live in Baltimore. We have Route 40, which is often called Highway to Nowhere. I'm sure you have your own highway that has been very problematic in Philly. So today, as we go through this talk, I want to think about how choices we have made as a society, as a country, with respect to where emission sources are placed in our cities impact present day air pollution, health impacts, and disparities. Oh, and in case folks didn't believe me, here's the same church steeple in both images. Now, I'm really thankful to Dr. Casey for kind of teeing up this slide really well, talking about how sometimes relying on surface level in situ measurements cannot adequately tell us all we need to know about variations in air pollution. I study NO2 or nitrogen dioxide a lot, and this is a very short-lived pollutant that has extreme heterogeneity in cities, as Dr. Casey showed in the example of Oakland. I don't use cool Google Streetcar views. That sounds very fun. I use satellites, which I think are equally as fun, but we can leverage satellite remote sensing to try to understand air pollution in urban areas as well as in rural areas. And there are a variety of statistical and geophysical techniques that we can apply to satellite data to try to match these space-based columnar measurements more closely to the concentrations that we are exposed to at nose level. So as I walk us through what I'll be presenting on today, I'm going to walk us through this causal chain. We're going to start by talking about land use and emissions in urban areas. I'll then talk about how choices that we've made about land use and emissions percolates or translates to present day pollution concentrations and how these air pollutions lead to health impacts. And then I'll wrap up today by talking about policy. And I think we all know that policy has kind of two different phases. Policy can either be reactive to something bad happening, or it can maybe be proactive and try to disrupt this causal chain before it starts in the first place. So I'll try to touch on that as well, if time allows. So we're going to start out with thinking about land use and emissions. You can kind of follow along on this causal chain if you look at the bottom right. The image that you see here is from a study that we published last year that looked at the growing warehousing and e-commerce industry in the US. I'm sure many of us have Amazon and use Amazon. Quick show of hands. Okay, yeah, I usually get like 90% or more when I ask this question. You know, we might order an Amazon thing when we're sitting on the couch or in bed and might not think that much about what's going on behind that one-click shopping. But there has been an enormous goods movement infrastructure that's been built in the US to accommodate these changing consumer habits. So in this study, we acquired a proprietary commercial real estate database called CoStar that allowed us to understand where warehouses were located in the US. And the way that you can interpret this plot is that if you take a look at this group of bars that's labeled any, this is going to represent the demographic difference between census tracts that have any number of warehouses and national median demographics. So we see that census tracts that have some number of warehouses, whether that be 1 or 100, tend to be more Hispanic, Black, Asian, and have folks that identify as some other race or 2 or more races. So that's not entirely unexpected when we think about urban planning and where emission sources are located. But what was really alarming to us in this study is looking at this stark relationship between number of warehouses in a given community and their demographics. And that's what's meant here by this clustering decile. So if you're looking at the first, second, third, or fourth deciles, these are going to represent those demographic differences in communities that have a small number of warehouses. Whereas if you're looking at the right-hand side of this plot, this is going to represent those differences in communities with a large number of warehouses. So with that in mind, we see these really extreme swings or switches in demographics as we ratchet up or increase the number of warehouses in a given community, such that by the time we get to the 10th decile, so communities that have the largest number of warehouses, these communities have between 200 and 300% higher proportions of residents identifying as Hispanic and Asian, as well as about 50 to 100% more residents identifying as Black or African American or biracial. So now we'll move on to this next link in the causal chain, thinking about how some of these land uses, whether it be interstates or warehouses or other sources of pollution, translate to our modern day distribution of pollution. These small jitter dots that you see in the background of these plots represent pollutant concentrations of fine particulate matter, or PM2.5, and NO2 in each of the about 400 census designated metropolitan statistical areas. And then the large dots in the foreground correspond to national level results. So what we see in this plot is that communities of color across the US and within individual cities face higher concentrations of both of these health harming air pollutants. And disparities for NO2 are much larger than those for PM, which reflects its shorter lifetime in the atmosphere and the more spatial heterogeneity that it exhibits. We've also leveraged the really unique time period and natural experiment that COVID-19 provided to try to understand more about disparities in our urban areas. So there's a couple things that we can take away from this plot. The first thing that I'd like us to focus on is the length of each set of those bars. The length of that bar corresponds to the magnitude of disparities prior to the pandemic and then during the lockdown and stay-at-home orders in early 2020. So you'll notice that for most of these different environments or cities, the length of that bar decreases during the pandemic. And that's good news that the pandemic, if there is a silver lining to the pandemic, is that maybe it reduced disparities a little bit. But good news is often accompanied by bad news in environmental health. So the bad news about this plot is that even during the pandemic, during this unprecedented drop in urban activity and emissions, many of the least white communities across cities in the US continue to face higher NO2 levels than the most white communities experienced prior to the pandemic. So not even this massive exogenous shock and all the disruptions with respect to emissions that the pandemic had could undo these deeply entrenched disparities. So now I want to move us to the next link in this causal chain, thinking about how these inequitably distributed pollutants lead to health impacts. These two maps show rates of premature deaths due to PM 2.5, and then new onset pediatric asthma due to NO2. And each of the different scatter plots corresponds to one of those approximately 400 metropolitan statistical areas that I showed a couple slides back. Now, I like maps, and I could spend the whole day looking at these maps, and I think there's a couple interesting insights that we can extract from them. One has to do with the spatial patterns of variability. What you'll see for PM 2.5 attributable deaths is that rates of premature death due to PM 2.5 are quite a bit higher in more broad regions. So I'm talking about places like the Gulf Coast that has lots of industry and petrochemical operations, as well as in the Rust Belt. So this area extending from, let's say, Wisconsin, Illinois, out towards where we're sitting today in Philly. NO2 has a very different spatial distribution. And with NO2, we can see cities light up that are not very large, but maybe have a busy interstate running through them or have lots of other urban activity. One thing about this study that was illuminating for us and has paved the way for some more work are these really large NO2 attributable asthma rates in the western part of Texas in the Permian Basin. So these MSAs include places like Lubbock, Midland, Odessa. I think there's a few more that I'm forgetting right now. But if we take a look at rates in these areas, they can often be as large as NO2 attributable asthma rates in Dallas and other really large cities, cities that are multiple times the size of Odessa or Lubbock. And this, as I said, has paved more work thinking about how oil and gas extraction leads to adverse health outcomes. And I know there's a number of others that have been looking at the impact of oil and gas in the Permian Basin or in the Bakken region and its impacts on health. So I want to start to wrap up, and we're at this final link of the causal chain, thinking about policy. And I wanted to close by featuring a study that we published last year that looked at violations of the Clean Air Act. Now, there are different types of violations of the Clean Air Act, and the most severe of which are called high priority violations, or HPVs, which has a different meaning depending on who you're talking to, but in this context, it's violations of the Clean Air Act. And the map you see here shows all locations of point sources of air pollution that received high priority violations during our measuring period. Now, according to Clean Air Act and EPA guidance, a facility is meant to address and resolve its HPV, or at least chart a path to resolving it within 270 days, which I believe is about 9 months, right? But if you look at all of these locations and look at the color bar, you're going to notice that a lot of these locations are colored black, which corresponds to the fact that these locations have been in high priority violation for sometimes 3 years or more. So they're not resolving their high priority violations at the rate which the Clean Air Act and other EPA guidance suggests that they should. We also took a look at these high priority violations in the context of disparities. And to do so, we used the now arguably defunct Climate and Economic Justice Screening Tool, or CJEST. And what we found is that there's about 35% of census tracts that were designated as disadvantaged in CJEST. Those tracts are shown in green here. And we find that about half of the high priority violations are located or in these 33 or so or 3% of census tracts designated as disadvantaged. So there's a slight disparity there with respect to where these Clean Air Act violations are occurring. We also sliced and diced these results more in the context of a traditional just percent people of color indicator. And what we found is that high priority violations in communities that have the largest proportion of people of color, so over on the right-hand side of this plot, are about 2 times greater than those in communities that have the smallest proportion of people of color. And this database that enables us to understand high priority violations also has information about recent inspections and penalties and fines. And what we find is that for every 1% increase of people of color in a given community, there's about a 4 to 5 day increase in the time since the facility's last inspection. So these results to me are really interesting because we're not just talking now about ambient air pollution, which I think even prior to this symposium, we all knew was higher in communities of color. But now we're looking at facility level violations. So this is not just saying that a facility is located in a community of color that happens to have higher air pollution. This is saying individual facilities are more likely to violate the Clean Air Act and incur these HPVs, these high priority violations, when they're located in communities of color. So to wrap up, I want to return to this picture and just say that there's a lot more work to do in this field, and to give a little more context for why there's more work to do in this field, I want to add a third picture now to the screen, which shows what the Reconnecting Communities project, which was a Biden-Buttigieg accomplishment that some of you might have heard about, what they imagined that I-375 would look like. So you ready for it? That is apparently how we reconnect communities. Not quite sure how adding more lanes reconnects communities. If you, well, this site's probably not there anymore, but when it was there, they kind of bragged about how they were bringing the highway to like road level rather than having it sunk. And I kept wondering why they kept returning to that point, because to me, that doesn't really make a huge difference. It's still an eyesore, still a big source of pollution. So all this is to say, lots of work to be done in this field, and I'm so happy that many of my fellow panelists and many of you here are tackling all these problems from different angles and with all your unique skill sets. So just to wrap up what we've talked about today, I've shown how we can use satellite remote sensing to understand urban NO2 and other pollutants at scales that are relevant for health and equity studies. And I know I didn't talk a lot about CO2 and methane and other greenhouse gas emissions, as is the theme of this session. But of course, we know that many air pollutants are co-emitted with greenhouse gases, and that solving one of them can often have co-benefits for the other type of exposure. I've also shown today how communities of color shoulder a disproportionate burden of the health impacts that are associated with air pollution. And a lot of this links back to ways that 10, 20, 30, 40 years ago, we thought about where to put emission sources and how to use land. And finally, I haven't had time to talk a lot about solutions, but in today's negative world, it's good to end with a positive. So I just want to say solutions are in reach. Some of the work that we are doing now tries to not just understand disparities, but to develop solutions to them. So we've been doing some modeling work using chemical transport models to understand how stricter engine controls and vehicle standards, especially for the heavy duty segment of our vehicle fleet, could reduce air pollution and help impacts in an equitable way. So that's all I have for today. Thank you all for your attention, and I'm looking forward to our discussion later. Thank you.
Our next speaker will be Dr. Kai Chen, who's an associate professor of epidemiology at Yale and faculty director of the Yale Center on Climate Change and Health. And in his talk, Dr. Chen will expand the conversation beyond mortality, which is often what we talk about when we discuss the impacts of climate change. And Dr. Chen is an environmental epidemiologist who focuses on the intersection of climate change, air pollution, and human health. And his work involves multidisciplinary approaches from climate and air pollution sciences to exposure assessment and environmental epidemiology to investigate the impacts of climate change on human health.
Good morning, everyone. Thank you for this very nice introduction and the invitation. It's my great pleasure today to come here and working with this amazing team and all of you to kind of talk about the issues that we all care about in studying climate change and health. So today I want to talk about one particular aspect is that when we talk about health impacts of climate change, usually mortality is the majority outcomes. And unfortunately, although we don't have a total number of the household of climate change, but mortality is the number that we usually hear about. So today we're going to be talking about morbidity evidences. So we think about how do we calculate the health impact of climate change. As Gabe already alluded to, we basically need several ingredients in this case. So first of all, we need your study population, what kind of climate sensitive outcomes you're looking at. And then the exposure, the climate related exposure, whether to existing climate change or future climate change. This is illustrated in Gabe's presentation. And then finally, we need the linkage between the exposure and outcome. However, in most cases, we don't know much information about what are the exact impacts on the climate sensitive outcomes. One of the primary reason for that is that we lack of quality data for these climate sensitive outcomes, especially in some of the developing nations. And consequently, we don't have enough exposure response functions that can allow us to conduct the corresponding health impact assessment. So my talk today is really kind of showcase the class that our lab has been doing, trying to understand these understudied morbidity outcomes from respiratory system disease to cardiovascular system to even mental health disorders. So at the Climate Health and Environmental Access Lab at Yale, we really try to embark the mission, try to reveal the true full burden of climate change. So today, what I'm going to do is share some of the past 2 to 3 years work that we've been doing in terms of temperature, air pollution, and extreme weather events. The first one, if you look at the figure, if you recall, in 2003, we have the Wi-Fi smoke travels hundreds of miles from East Canada. So the sky in New York City turns orange. And that was at least a wake-up call for many people in the eastern part of the US to recognize Wi-Fi smoke is not just a Western thing, right? So at that day on June 8th, New York City's average air quality, the daily total PM2.5 level, reached about 150 microgram per cubic meter, which, as you can see, normally is below 10. So consequently, we take a look at New York City has an advantage that it has a near real-time syndrome surveillance system that it gets almost all the emergency department visits very quickly. So we take a look at asthma cases across the New York City. We found that if you compare the asthma ED visits during this 3 days Wi-Fi smoke wave, both before and after the smoke period, we can see there's about 40% increase. So this instance is so severe that we don't actually need a sophisticated statistical method to see the signal. That's the same thing we actually see decades ago when we see the Chicago people, right? This the second study I want to share is when we look at the temperature exposure impacts on cardiovascular system diseases, a lot of the things we nowadays can leverage is the health insurance claims. So in this study, we work with private and nationwide health insurance company that actually can give us access to the individual cases of acute myocardial infarction instances. So we link data records with the temperature and air pollution, and we conduct analysis showing that not only when temperature goes up higher, but also when ozone levels, ozone levels higher, you're gonna see an increased risk for these acute myocardial infarction instances. And we here focus on this particular population that is the younger adults, because as you may have read from the papers, there's many studies using the US Medicare population, which are primarily older adults, right? So we embarked the question, What about the young adults? Are these also vulnerable? So we took this opportunity, leveraging this priority insurance company's data that can show us that both heat and ozone exposure increase the risk, and also when you see their joint exposure. So interestingly, when neither of them are very high, when they are even at the moderate level. So here at this range, you could see there was still significant increased risk. So we did this kind of joint exposure analysis. These lines, p-values show significant areas where this joint exposure would lead to significant increased risks. If you want to learn more about the methodology, please pay attention to the poster presentation by Dr. Chu on Thursday. So we did another study looking at a stroke in the same population. We found, unlike acute myocardial infarction, here we only look at temperature, and we found basically a monotonic increase that basically temperature goes higher, you get a significant increased risk for stroke. That is unlike what we see others when you look at older population that has a significant cold effects. So that might be something special when you look at a younger population.
I do want to click on that bar at the top.
Okay.
And,
Okay,
thank you.
perfect, thank you. So another way we look at this question is, leveraging the existing cohorts. The many cohorts in epidemiology, in medicine, they're initiated on a different question. So here, in collaboration with Professor Helen Kronholz at Yale, we've been able to work with them using their Virgo cohort. So they did this study because they found out the acute myocardial infarction in younger adults actually has much higher prevalence in women versus men. So they did this study, recruit 3,000 participants across 100 hospitals around the US. So we've been able to work with them and assign the air pollution exposure. So in this case, we assign the daily ambient ozone exposure. And what we found is that using case crossover design, we found that short-term ozone exposure can lead to significant increase, not only the total acute myocardial infarction instances among these younger adults in the US, but also found the major categories like STEMI or non-STEMI, even type 1 or type 2 acute myocardial infarction instances. So another type of data, especially when we look at cardiovascular disease, we try to utilize is registry data. So there are many nationwide registry in the US, in China, and Europe. We previously did a lot of studies in Germany when they have established some of the regional specific myocardial infarction registries. So in this very recent example led by Dr. Ban from the Chinese National Institute of Environmental Health, we utilize a database that actually is established from the Chinese Cardiovascular Association's database. Their chest pain center has a nationwide registry for the acute coronary syndrome that includes more than just acute myocardial infarction. We use this more than about 2 million cases in over about 1,800 counties in China. So we again match the exposure during the historical period from 2015 to 2021. And because we're interested about climate change in China, unlike here in the US, there's not much debate in the political area about the determinants to address climate change. The Chinese government has a goal to achieve the carbon peak around 2030 and then achieve the carbon neutral in 2060. So here in this study, we try to see when these two climate-related policy targets peak in 2030, 2060, what are the future ozone-related impacts on this acute coronary syndrome onsets would be. So to do that, we combine all the climate projections from 3 of the global climate chemistry models. And we assign this daily 8-hour maximum ozone data for each of the cases. And then we also consider the future population trends. And then we estimate that in the future, we can see in 2030 and especially in 2060, there will be a significant increase in the short-term exposure to ozone-related acute coronary syndrome onset, especially when we look at older adults. Another example that we recently conducted is looking at heat exposure and actually childhood cancer. This is a study that we've been working with Dr. Xiaoming at Yale. They have established a study in California linking the early onset cancers from the California cancer registry with their birth records data. So we found that during pregnancy, especially during the gestation week 8, high temperature exposure will actually lead to the increased risk for acute childhood leukemia. And we also did a lot of study for mental health. There's many studies using emergency department visits and a lot of electronic health records data. But there another type of data that was relatively less looked at is the children's leave of absence, their records data. So in collaboration with some Chinese colleagues, we look at the causes of why these children take these absence leaves. And we found that actually the temperature exposure, whether it's daily mean average temperature or these kind of temperature variation metrics, they all leads to significantly increased mental distress among these children. The next major type of data source that we've been working with many in this field has also been utilizing is survey data, especially in the developing nations where they don't have this routine registry or administrative data. So here, led by Dr. Ping Wang, we look at the childhood diarrhea instances in the demographic health survey program, which was funded by USAID. And in these two studies, we look at drought and the flood exposure. We found both increased the childhood diarrhea instances. And then recently, we also look at the intimate partner violence among these countries, and we found that drought also can increase the risk of intimate partner violence, whether it's emotional or physical or even sexual violences. We see that significant increases. There are other studies looking at this use focusing on heat exposure and others. So we see kind of the similar patterns. And also another study, we look at the drought exposure and childhood stunting using the DHS survey. We found there's a significant increased risk, but also when we look at Wi-Fi smoke, because we like the LA fires, it's happening because there was a severe drought happening before, so it kind of exacerbated the existing Wi-Fi conditions. So we found that Wi-Fi air pollution can actually serve as a mediator. And in this particular case, it can approximately explain about 1/4 of the linkage between drought exposure and childhood stunting. Lastly, one resource that has been actually utilized a lot in air pollution studies is hospital records. So all the time we don't have this nationwide or big registry data. So what we're going to do is we're going to work with local partners, even go to the hospital, working with each individual hospital to use their electronic hospital records. So we did a study in the US looking at the nationwide county-specific mortality and flood exposure. And similarly, another team at Monash University, led by Professor Yuming Guo, they actually go out to collect hospital records in 8 countries. And they found that flood exposure lasting up to 210 days can lead to substantial increased risk for all cause and all these cause-specific hospitalization data. So I think that will serve actually a first start if you don't have this large mobility database, maybe working with your local partners to get the hospital records, outpatients, inpatient, emergency department visits. That may be our first start. To summarize, so we see that climate change impacts our health through both these extreme weather events, but also indirectly so air pollution and others. It interacts with the social dynamics, as many of panelists has already emphasizing. It impacts a variety of mobility outcomes. Although we don't know the full picture, but we can utilize this real world data is already out there. We can try to find ways to collaborate to gather this information to quantify these mobility impacts from climate change. Lastly, I want to mention that although the research on mobility and mortality impacts of climate change is just on the tip of the iceberg, but it's imperative enough for us to take actions. And at the end, I want to acknowledge all the funding support and all the lab members at the channel. Thank you.
Hi, everyone. Our next speaker will be Dr. Tariq Manyan, who's a professor in epidemiology and climate sciences at the University of California, San Diego's Scripps Institution of Oceanography, where he leads the climate change epidemiology lab. Dr. Manyan's work focuses on applying and developing causal inference methods to understand how environmental and social determinants affect population health and equity in the context of climate change, but also what strategies are effective at minimizing such impacts. So this talk will conclude the session, focusing on emerging methods to consider heterogeneous impacts of climate hazards.
Thank you so much.
Good morning, everybody. Can you hear me okay? Okay, so thank you so much for the invitation, for the organization. Very happy to be here this morning with very good friends and colleagues. So I, just before getting to these specific topics, like talking about component impact and try to really understand, try to disentangle what is happening beyond an average effect for a specific type of extreme heat event, a specific flooding event, or any type of climate sensitive exposure. I will explain how we can actually approach that. But I hesitated a lot. I was about to talk about dynamical exposure, which was also kind of related to what John talked about, talk about different types of health issues, but I eventually talked about that because I thought it would be more just like inspiring for like what most of you are doing in different geographical contexts to try to seek new type of ethical questions and talk about and introduce this concept of compounded. Just to give you a little bit of background about where I was coming from. And I'm just going to just the time because I predicted that would be behind. So okay, so that's the menu for today. So I will first just like for those who are not very familiar with this concept of common climate hazard or common climate events or exposure, I will present a few typologies, including one that we recently adapted from the climate science world into the public health field, and simplify it by focusing on what we call spatially component hazard and temporally component hazards. And in each case, I will talk about what we can consider to be traditional approaches that has been used and present few examples, and then we'll talk about more kind of present or methods and opportunities to study new types of questions. And at the end, I just have one slide about how like using this information about component climate stressors can be actually useful to think about new ways to adapt to climate change and think about public health interventions. That's kind of what I'm planning to talk about. So just about some motivation, because when we look at the climate and health literature, it's very, very common to study on one single climate sensitive exposure. So it can be, you can have studies about ambient temperature or different types of extreme heat events. We can have studies about hurricanes, typhoons, etc., wildfire smoke events. So that's most of the literature, what most of the literature is doing. But this is also quite important to try to understand like what is happening in different settings, temporally and spatially, when, for example, there will be an extreme heat event at the beginning of the season, or when there will be an extreme heat event, but just like 2 weeks after a wildfire event, and so on and so on. Or in different contexts, what is happening when at the same time you have an outbreak or dengue or malaria, for example, when you have an extreme heat event at the same time. We can't consider homogeneity here. And this is why just trying to understand like the drivers of this kind of heterogeneous impact may be quite useful. And this is what I'm going to talk about. Because this impact can be disproportionate, can have like differential impact, and that information can be quite useful instead of thinking about one set of exposure, quite like understanding how specific exposure may have just like variations in how they impact different communities is quite useful to just prioritize different types of actions and different communities as well. So that's, and also, and we talk about that at the end, it's also like offer opportunities to think in new ways in terms of how we can adapt and how we can think about different types of policies in urban settings and elsewhere. And I will give a few examples at the end, mostly focusing on wildfire, but also on extreme heat and ozone. Okay, so there are a few typology when you look at the literature about this concept of compounded climate hazards. The most common one is that actually I'm going to talk about mostly today is by, okay, I have a complex name to pronounce, but this one is like the next level. So we need to try that. Schleifer. And so they proposed like a framework that has been used in different assessments, including the NCN IPCC 6 report. And they proposed a classification of how we can think about compounded climate hazards. So not related to health at all. So, but in the next slide, I will explain how we can actually simplify this typology and adapt it to epidemiological settings and details. So this is in this framework, actually they propose to include like 4 categories of compounded climate hazards. So first one is what they call preconditions, where you have a specific climate precondition that will lead to an amplification and installation of different types of societal impacts. Then they talk about temporary compounding, multivariate compounding, and spatial compounding. So temporary compounding is really when you have this kind of sequence of climate sensitive exposure. So you can have, for example, 2 or 3 extreme heat events in a row, or you can have extreme heat event followed by a wildfire event, by a flood, etc. So this is what is by temporary compounding impact. And then when they talk about multivariate, and this is where I think we have to do some adaptation in terms of the typology. This is really when on the same day, in the same location, same city, in the same community, there will be multiple climate sensitive exposures that will take place. For example, today in Philadelphia, we can have a extreme heat event and an ozone peak, for example. That will be typically what they call a multivariate event. And then they distinguish that from what they call spatially compounded impact, where you will have this kind of same climate sensitive exposure taking place to connected spatial units. So in the next slide, I will show how we can actually just combine these two for simplicity, and also for today, this is what they did. But there are some differences and subtleties between these 2 types of compounded or types of compounded hazards. So this is really like the most commonly used typology or classification for compounded climate hazards in a field. And they also provide a few elements about how to describe these compounded hazards. And if you're interested, so this is very like general and has been used in multiple reports. This is where like a good place to start. But what we did following that is to actually take this type of typology, and also because in the literature we can also find a few papers that will also talk about concepts such as climate exposure, which is the same idea when you're going to think about how people and communities or individuals are going to be exposed to multiple high-dimensional exposure across their life course. And that's like a similar idea, just to move beyond just that single exposure and homogeneous impact from climate-sensitive exposures. So in this specific review that I don't know when it's going to be published, but eventually in the next few months, we actually just like summarize that and also like reviewed the literature about this specific topic and try to organize this kind of synthesis of the literature according to this typology. But today, for simplicity, I will just talk about spatially compounded hazards and temporally compounded hazards. So spatially compounded hazards, when on the same day we will have like 2 or more climate sensitive exposure, so extreme heat event, ozone peak, wildfire event, etc. And temporally compounded hazards, where we have like this kind of temporal sequence between them. So this is really what I will focus on today about. So obviously, when we look at the literature, the huge majority of the literature focused on the spatially compounded impacts, focusing mostly on joint exposure between extreme heat, different types of extreme heat metrics, and different types of air pollutants, both on the short-term exposure and long-term exposure of acute versus chronic effects. So this is by far what most of the epidemiological literature focused on. So this is very briefly just like how we try to adapt this kind of typology to the new context of wildfire. So we took like wildfire as an example to show how it can be like decomposed in the context of this typology. But this is just like I'm not going to spend more time on this one, just to make sure I can cover everything else. But it's just something you will find. The purpose is just to show examples about especially how it's important to distinguish multivariate from spatial compounded. Anyhow, so now I'm going to talk about just like how we can do that. So first, and that's like the easy part, is how we can study spatially compounded impact. So we can think about traditional approaches that have been used a lot to study like the joint effect of 2 or more exposures. And that, again, that has been used for short-term and long-term exposure. And there is like a systematic review on this specific topic from a few years ago, focusing on this specific type of question and review this literature. That has been updated since, and this is just really what we talk about when we talk about spatially compounded hazards. So how we do that, technically speaking, this is really related to this concept of effect measure modification, which is quite, I assume that most people in this room are familiar with this concept, but this is really what we talk about. It's really when we have like one exposure of interest, for example, and when the specific effect of this exposure is going to differ according to the status of the third variable, a third exposure. Of course, there's conceptual distinction between, in epidemiology at least, between what we call effect measure modification. So it's effect modification which is scale dependent, and that's actually important. I don't have time to talk about that, but this is a distinction is quite important. But there was also a distinction between effect measure modification and program interaction, which has a lot of implications, especially when you think about the potential interventions. So this is really what we talk about when we talk about these type of issues. And there are many approaches to actually think about effect modification or interaction, depending on what is the causal question of interest. We have the stratified analysis, which is by far the most common approach, in which you can stratify two or more groups and then conduct a heterogeneity test, such as a world or country test. You can also try to include an interaction term in your model, but you will have to be careful about what your model is about, because the interpretation of your interaction term is going to be scale dependent. So of course you have a solution if you're interested by additive interaction, additive effect modification from multiplicative model. This is totally possible. And of course you have more recent methods that also can be useful when you want to think in terms of intersectional aspects. And you can think about high dimensional effect heterogeneity, and you have a lot of recently developed algorithms to deal with that, including generalized van der Forest and others. And if you're interested, we recently published a tutorial about all of this method and how it can be useful. And you have examples, data sets, codes, and everything if you're interested by that. I need to wrap up. So I just wanted to present one example about what we mean by spatially composite impact. But this is here just like very simple about how we can think about the effect of extreme heat on mortality risk. And here you can see this effect of heat stratified by different levels of ozone. And you can see, for example, in Italy that the same contrast works like temperature effects on mortality is going to be exacerbated when ozone levels are higher, which is what we mean by spatially composite impact. So you have a lot of examples like that in the literature. Then, and I'm going to be very fast on that, it's usually these kind of inferences are made at the city level, at large scale level, but it's also useful to think about this kind of spatially component hazards at like a fine spatial level. And there are methods based on like different approaches, including a Bayesian hierarchical model and other types of spatially varying coefficient model, in which we can actually have spatially varying coefficients about the amplitude of these spatially component impacts, just to know where like the intersection between, for example, extreme heat and wildfire smoke, in this specific example in California, is more exacerbated. And we can also from there try to understand what will be the drivers of this kind of differential synergistic effect between extreme heat and wildfire. And here, for example, we can see that the higher the number of individuals with health insurance, the lower the synergistic effect will be. So that's just an example about traditional approaches and more recent approaches that allow for the spatial variability. So then I wanted to talk very briefly about temporally compounded impacts, which is less studied and I think way more exciting and interesting, because at the end of the day, it'll be very interesting to also think about how we can prioritize adaptation strategies. So like traditional approaches are like exist a little bit, and it's really about studying the sequence of different types of climate hazard and climate sensitive exposure and seeing how this sequence or differential sequence are going to exacerbate health impacts. So you have simple approaches in which, for example, you can compare the first or the second event of the season. That could be the case for extreme heat, for example, or flooding. And then also try to understand how the time since the last event may amplify or modify the effect of a specific event. And this is like the two examples I wanted to show you. This is here in France, just showing how the first versus the second extreme heat event, and we compare different extreme heat definitions in France, how the effect on cardiovascular and respiratory mortality may change according to the specific timing of this type of extreme heat event. And here, this is another example about wildfire, and like we use specific definition of wildfire smoke waves. And here, this is just to show that the effect of a given smoke wave definition is going to be higher when the previous smoke wave was shorter in time, just to show this kind of the importance of this kind of sequential aspect. So this is really how we can very simply study like this kind of temporally component impacts and try to study this kind of sequence of events and see that the effect is not homogeneous. And here it means that when a smoke wave event is going to lead to an increase in hospitalization for different types of respiratory conditions, this effect is going to be exacerbated if the last event was close, like closing time. But then, what I want you to propose very quickly is about how we can generalize this type of framework to study non-party compounded impacts. And like the idea will be to actually treat climate sensitive hazards or climate sensitive exposure events as natural experiments. And if, and that's usually easy to do, we can argue that the specific timing of extreme weather events is independent from the trend, the temporal trend of like a health outcome of interest, which usually is totally the case. The timing at which the specific wildfire smoke events comes to a city is usually totally independent with like the rates of asthma, hospital admissions, for example. So as soon as we can make this articulation, we can capitalize on the natural experiment to study this. And then we have multiple approaches to actually use and capitalize on such type of timing of natural experiment, including difference in differences methods, sensitivity control methods, and intra-differences analysis when you don't have access to control. And by focusing on this kind of single multiple events, we can also try to understand like the kind of to which extent across multiple events is any heterogeneity in health impact. And if yes, what is driving that, including temporal and also spatial components? So that's kind of a framework to try to generally understand the drivers of heterogeneity in general. So it's as kind of projected. It's I don't have any time, so I just wanted to just like go very quickly. So the last day I wanted to present a few examples about wildfire in California, about how we can actually study that using general sensitivity control method, and just to show like the variability for the same wildfire event across different locations in California, and also how we can actually use inter-state time series analysis in two states. But gladly, John talked about that a little bit earlier to study wildfire, so I don't even have to do that. But there is a paper in which we present this approach, and in which we show how we can actually like coupling that with different types of machine learning algorithms. And I don't have time to do that. Hopefully you have a question about how it translates into policy. So thank you so much.
Thank you so much to our speakers for their great talks. Now I would invite speakers to sit in the front, and we can start our Q&A as we have a little less time than expected, but still. Thank you. And if somebody has questions in the audience, I can just come up and turn them.
We save 10 more minutes. Let's look at their questions. Or, yeah.
Any questions? Usam.
Yeah. So just, answering, asking Tariq's question. So, very complicated, two-stage approaches, a lot of variability. I saw a lot of numbers there. How do you explain that in a way? How do you explain this kind of temporally sequence methods to a policy audience? What are the the implications of what you will have shown there had you had more time?
So the idea is really about treating. So usually the literature is really about how we have like an average treatment effect across multiple extreme. Let's take extreme heat as an example, but of course it applies to any type of chemically exposure. So instead of having an average estimate about for 15 years in a specific location, there will be this is an average treatment effect for the different definition of extreme heat. So that's kind of what we used to. But here, this is about moving away from that and try to understand, just like, first, is there any heterogeneity? Because it may not be the case. Maybe any type of extreme heat event, whatever the definition in a given location, will always have the same effect in a given community. Without talking about the heterogeneous effect within this community by community characteristics, so but that would be a conversation for tomorrow. But here the idea is to, okay, how can we just like understand that comprehensively? So the idea is really to try to analyze each extreme heat event separately and try to quantify for each extreme heat event. So let's say if you study Philadelphia for 20 years and you whatever definition you use, you may have like 100 extreme heat events during this study period. So the idea is to have just like 100, a distribution of 100 ATT, average treatment effect among the treated, like in a specific setting, and try to first analyze if for the same definition of extreme heat, does it change? Does it change over time? Does it change according to other settings? For example, it's it's easy to have to think about how the same type of extreme heat condition 20 years ago may not have the same effect nowadays. So calendar time may play a role. The same extreme heat definition taking place in June may not be the same as the same definition in September. The same definition in on June 15th, for example, may not have the same effect on a given health outcome if the previous heat event was 3 days before, or if it was last year, and so on and so on. And you can also, on top of that, for each of these extreme heat events, you can assign different characteristics, the amount of ozone or the amount of PM2.5, and so just try to comprehensively understand how, what drives heterogeneity of species. And I think for policy, it's quite important just to move from this one size fits all aspect. So that's really the idea. Thank you.
I'm gonna steal yours. I actually think what Tarek is saying is super important and actually easier to explain to policymakers. Because I think intuitively people get exactly what he's saying. Like, if this is the third heat wave that we've experienced in 3 weeks, of course we're depleted. And of course we're not going to feel as well. And actually, I think it gets our models much closer to describing reality that is the lived experience of people. And so I actually think it's really exciting and much easier than trying to explain the average treatment effect to a policymaker to say, now we can get this nuance. Now, of course, community characteristics make a difference. If we see AC penetration is really important, people, if there's AC, things are easier during heat wave. So I think it's matching closer to our reality and it's gonna help us a lot in talking to policymakers. So yeah, I'm excited about it.
Any other questions?
I just want to add to that. I think I really like the aspect of compounding events. I think it's like the whole moment to expose them. When we talk about climate, it's often some individual events, but in reality, it's multiple events happening. So I think whether it's temporary, spatial, compounded, that's gonna be important for us provide evidence for precise management. I think you didn't talk about the early warning, but I think that's going to be very important because let's say same flooding events, whether it has a drought events before, the risk that we found childhood diarrhea is very different. So that actually leading towards to more precision management, but that needs a more complex full picture of the health country from these compounding events.
This is more of a general question, but piggybacking off the previous question, I was wondering with all these studies and the data that comes out of a result of it, how would you transcribe this data into potential legislation to appeal to lawmakers and policymakers? And how would you keep your best interests in mind without having to compromise towards their position or their remarks or criticism?
Okay, great. Yeah, that's a tricky question. So I think I would first start by saying, ideally, we don't get these results and then talk to policymakers. I think more and more I've been finding we need to talk to policymakers and then do the study and then get results that are useful. A quick anecdote about this. So Gage talked a little bit about oil and gas development, and I've done a lot of work on fracking and health in the US. And we spent a lot of time trying to develop really accurate exposure models to link people to their fracking exposure, what phase of development it is in, how much water is being pumped in the ground, how much production volume is happening at these wells, and summarizing exposure using kind of a complex spatial model. But at the end of the day, policymakers have a lot of trouble explaining that to one another and to their constituents and regulating on it. And really what they needed me to tell them was, how far away from the well is it safe for people to live? How far away from a well is it safe for a school to exist? We can get a setback distance from these wells in place without too much trouble. But my fancy exposure model did not give them that information. And so it would have been a really helpful conversation to have, I think, doing both. doing as well as we possibly can from an exposure assessment perspective, but also having some more simple results that could translate potentially more easily into policy change. And so I wish if I could go back in time, that is something I would have done in, a supplement. We can have 3,000-page supplements now, so that's something I think that we need to think about, but the main overarching point is these aren't conversations that should happen once your Nature paper comes out. It's a conversation that should be happening wherever your study is being conducted early on, at least some preliminary, more casual conversations about what kind of information do you need to affect change in this place.
I'll maybe add to, if you recall the picture, one of the pictures I started my slideshow off with was the folks who have assisted in publishing the papers I presented. Lots of them come from stakeholder organizations. There are folks from C40 Cities, International Council on Clean Transportation, others. So I've been really fortunate to kind of been joined at the hip with these folks throughout the research process, to build on what Joan said, that we need like direction as scientists maybe for how to orient our results to something that's policy relevant. And then when the studies do get published, it's really maybe fun is too strong a word, but GW is close in proximity to the Hill, to all these national level policymakers. So it's been fun to work with our government relations office to set up meetings with like the Senate Committee on Transportation and other committees. And something I've learned that maybe isn't that profound or groundbreaking is that they want like local insights. They want to take these national level studies that we can talk about how great our sample size is and how we have complete spatial coverage from satellites. They don't really care. They want to know what's going on in their district or their home turf. So that's been also helpful for me to see kind of how deliverables vary between us as scientists and policymakers.
Yeah, I just want to add that I think a lot of the research we do, I think, is aiming for policy implications. And there's a big difference between policy implications and policy impact. And we really need a lot of folks to devote the time to like translate the science findings to the impacts that can on legislatures or even in court rulings, right? How to better prepare some of the climate-related, cases. So I think that's the one of the main issue is that like a lot of the health impact assessment, the kind of foundation is providing is on either the health benefits or any action that we can take to address climate change, or the health impacts. We're not only talk about the life lost, the hospitalization. We're talking also about in terms of the total health cost lost. But that unfortunately currently is not on the equation. You naturally, if a government to do a policy evaluation, they should consider both costs and benefits, and the potential benefits from addressing climate change. That's something missing, and that cannot be done when, let's say, if you have the Texas flooding events, when you have the administration is basically saying this so unfortunate, let's just forget about it. These are not related. So I think until you have the evidence to show how much flooding related health impacts are there and how much can be attributed on ongoing climate change, then you can put the equation balance. Then you are not only thinking about all the money are devoted in to address climate change without thinking about all the potential benefits. I think that's what we can provide for the health implications, but it's very different from the actual policy impact. I think for me personally, the rationale why I am interested in this area of research is that in China, if you look at China's air quality policy, so in China, it was one of the worst country with fine particulate matter, about 700 microgram per millimeter in some of the extreme episodes. And very quickly, in 10 years, the air pollution dropped significantly from establishing the nationwide monitoring system to all the efforts the central government is taking. Why they are doing that? Because at the time around 2010, the GBD studies and others are having the numbers saying air pollution in China is killing 1 million or more people every year. So that become a huge political kind of issue for the central leaders, they want to address that issue. So that number becomes the determination for the central government to take actions on that. So I do hope the evidence we provide, maybe not today, but maybe tomorrow, will provide the critical determination for not only one country, but all the countries together to address this question.
Yes, and then.
Okay, thank you so much for the question. So I will start very like high level and then just like go to some example just to illustrate how we can actually do it and so like connect with what something that makes sense. So first of all, I think something that I think is very makes us like public health professional, public health scientists a little bit perspective and from other scientific disciplines interested by causal inference, because most of what we talked about today is really about making inferences about what happens if we change this to a given health outcome. This is what we care about. But what makes public health a little bit special as compared to biology or other disciplines like that is that we're very consequentialist, we're very utilitarist. We really want to study things because we want to make a change in the real world. That's something that I think makes this discipline a little bit different from ecology or from physics, etc. And I think this is like embedded in everything, any training in public health. This is we learn causal inference to just like think about actionable things, actionable interventions. So thinking about how we're going to define exposure contrast, thinking about how we're going to think about existing policies. So it's critical because we really want to make a difference. So it's better to save some time and just go directly to some kind of metrics or contrast, causal contrast that actually makes sense in relation to existing policy or existing like policymaker preferences and how they think about changes. Then the second part is also about just maybe like, and also today is easier than 20 years ago. Which, for example, like, and John showed that today, like, there are a lot of tools that help just like this kind of translation, like Shiny app, like Shiny's app are actually very good, like very good just to not only present data, simplify visualization of data set, but also to show, highlight, just like hypothetical changes following different types of interventions. So right now in my group, we try to do that quite systematically. Each time we have a paper that has this type of application, we also publish a Shiny app in which just like anybody can go like click and see what will happen if you do this, this, and that. And in a very like interactive way, easy way to, so it's not a lot of work now. I mean, just like now that we actually develop the pipeline, but this is actually useful. And we found that when we go and meet with different stakeholders also, this is useful just to have this kind of platform in which we can just like say, oh, this is what will happen in this zip code or social collocation, whatever, like, whatever like this kind of community characteristics are about. This is what will happen if you do this, if you do that, etc. So this is just to help this kind of conversation that you have to have eventually. And third, just like connect a little bit about the implication of what we talked about this morning, just wanted to give this example about how just like without this kind of information about heterogeneity, the complexity of multiple climate sensitive exposure, we could not even think about new types of policy. One example that I wanted to highlight is about extreme heat and ozone. So as you know, when there is like extreme heat event, this is really like conditions that will be perfect for tropospheric ozone to be generated. If you have a lot of sunlight, if you have like not too much humidity, and if you have like high temperature and precursors like NOx, etc., that would be perfect for ozone to be generated. So there are a few studies that actually show that in some settings, when there is an extreme heat event, again, whatever the definition, actually ozone acts as a mediator when you think about it. So you can calculate the proportion of whatever health outcome, say mortality, for the sake of the example. There will be a kind of not trivial proportion of deaths happening during this extreme heat event that are not due to the temperature by itself, but instead will due to the increase in ozone generated itself by the increase in temperature. So, and in some settings, this proportion mediated, or this proportion of deaths attributable to the ozone generated by the extreme heat event, can be up to 40–50%, which means that even if you have a perfect policy to address the temperature exposure, like 50% of the deaths typically during this specific type of day are going to happen anyway because this is a gas instead. So it just like highlight how in some settings where you find this type of patterns, it could be a good idea to combine, assuming that the precursors of ozone are mostly from traffic, for example, in a situation like that, it could be a good idea to combine an early warning system for extreme heat to like just like intervention in the days before the extreme heat when it's forecasted to try to reduce emissions from traffic, for example, just to actually just reduce the probability for a lot of ozone to be generated in this extreme heat event. So just as an example about how this evidence can be useful to think in a new way about how to think about warning system, because just like one example among many, but just to highlight.
Thank you. Yeah, I think this has been a great panel. Thank you so much. Very complimentary presentations. I just wanted to kind of raise the issue, think about where we are today in this topic. I mean, there's a report that just came out from, I think, 5 kind of handpicked scientists from the administration questioning even the existence of climate change and its impacts. There's a report, a report with critique of that report was recently submitted. I haven't read all this in detail. Maybe some of you have seen it, but I think we have to remember we're at a stage now when it's not necessarily even about developing evidence for specific policies. It's about putting back, questioning the questioning of this topic of climate change. And so I think my question is, how can the great health evidence that all of you have been generating, very sophisticated, very increasingly nuanced, how can it be leveraged at this time to to really raise the social visibility of this issue, and I think, we have this tension within public health about being, quote, consequentialist in what I think is a very narrow sense, provide evidence for a specific policy versus being consequentialist in the sense of raising this as a fundamental social issue that, in order to be fully addressed, will require a lot of changes, systemic changes, not just doing one small thing in one small neighborhood. So I guess my question is whether, how you guys do you think the health evidence that you're generating can be revitalized now in ways that can help us counter the argument that climate change does not exist or is not having a significant impact on our society, or is just not worth dealing with because of other economic impacts?
Thanks. One thing I want to add on is that Yale has a program on climate communication. They do the surveys. So from their surveys, actually, the survey participants reflects like Americans generally, the increasing number believing climate change is real, is Earth, and the increasing number of people believing climate change is damaging our health. So they're actually, I think, speaks of today's political realities a little bit different. And one thing I'm particularly interested in is that kind of perception difference, that a lot of people will think, oh yeah, this is real, it's happening, but it's perhaps not affecting us personally, right? I'm young, healthy, and I'm not in a deprived neighborhood, so that may be not my issue. On the contrary, we have a colleague at the Yale Center for Geospatial Solutions. They look at the surveys, their risk perception of heat. So how you perceive yourself on suffering heat exposure versus a heat vulnerability index that we created at every sensor track level. So there reviews some large discrepancies between what people perceive that they have the risk versus what actually we have in terms of vulnerability to heat. So I think revealing that differences might able to help motivate people to take actions on. But heat is, among many explorers, the most studied one. We don't know much about, your neighborhood level flooding risk, the neighborhood level like Wi-Fi risk, right? So I think that's something we can build evidence and then make it, at least from our perspective, like Tarek said, we're working on also creating dashboards, trying to reveal the county level mortality burden that unfortunately we do a lot of mortality-based studies, but that's all peer reviewed, then we can make it available and towards that direction. So I think that's maybe it works, maybe not, but that's my idea that I'm interested in pursuing.
I'm kind of a glass half empty guy these days, so I'm not convinced that any evidence we've generated can really move the needle, unfortunately. However, I do think that maybe appealing to the kind of economic aspects of what we study is one direction that I've at least been trying to touch on. I think we're all up here because we care about public health and lives. The people in DC, probably not as much, and maybe try to translate some of the premature deaths or different forms of morbidity, or some of the work I've done has tried to monetize like what a new pediatric case of asthma, the costs that are incurred through that case. So maybe if we can translate some of our findings into actual dollar signs. And going back to my previous point about distilling it down to a state or a congressional district state, we forecast that this climate sensitive exposure is going to result in this many dollars spent in whatever 2040. That could maybe be a way to reach people that really only care about the bottom line.
Thank you. So maybe just one quick remark.
Okay, I'll be super quick. Who in this room has seen the cartoon Bluey? Yeah, okay. So I have a 4-year-old, so I've seen a lot of Bluey cartoons. And there's a particular episode called Veranda Santa. So Santa cannot come down the chimney. The chimney does not exist in their home, and Santa has to come in through the veranda. And they make it work. So I think we now need to come in through the veranda. We're in, I mean, this is like a soul searching question. I think it's easy to keep coming back and doing fancier methods and getting more precise causal estimates, but at the end of the day, the reality may be that with the way social media is going, the way the conversation is going, we should have to shift some of our effort to work differently, to communicate with all Americans, because it is going to be this emergent thing where we do need national policy change. And I mean, when you talk to people, they agree. I think most Americans agree wildfire smoke is not good for your health. People don't feel well when they're exposed to it. They're getting headaches. People know they're going to the emergency room. So I do think there are commonalities in our realities here still. And so starting from that place of a common reality where we now have kind of bifurcated into many realities, and dealing with that's extraordinarily challenging. And figuring out how we're going to come back to have a shared enough vision to create this change. I mean, I think that is like the question that we have to work on together. And so, yeah, that's definitely the thing that keeps me up at night, because I agree. We can have all these high quality epi studies, but if we do want to have this change, it's going to take a lot more than that. So I think it's going to be interdisciplinary. It's going to take us coming in, yeah, through the veranda.
Thank you so much. But thank you so much, everyone, for the wonderful talks and for the engaging discussion. We have just a couple of minutes before the next session.
I think we can delay the start of the next session.
Okay, when should we start?
At 11.
Okay, so we can start at 11, and so far, like in the meantime, people can take advantage of the coffee at 11. Thank you.
I think you were that.
Okay,
And honestly.
right. Seems like it's good
So I
now.
think we want to test out. Right.
Seems unmuted. Yeah.
Hey, hey, check, check, 1, 2. All right, cool. This coming through stream, no echo.
Thank you.
Amazing. I'm gonna get some lunch.
Yeah, and then the later they seems like they said it. They have like their, but that's not what we're learning about. Yeah, right. But like. No, not. But let's leave the. So that means.
Hello.
Yeah. Testing, testing. Testing, testing. Can you hear me? No echo? Did that work for you?
Not sure if I'm picking up from my app or.
Okay, Gianna wrote. Thank you. We're good. Yeah, thank you. There should be a calendar,
Okay, you're the youngest of all the people. You work in the disease control epidemiology section in the university?
Yeah. I did, I worked as a data analyst.
This is too.
So anyway, you're more than welcome to.
Okay, sounds good. Thank you. Were you sitting here?
Yeah, I think that's there.
Well, the end of the last panel was exactly about what is this about. So we will go deeper and deeper into the conversation.
Yeah.
Hello, everyone. Good morning. Thank you for being here. To all of you for being here in person, to all of you online. It's a pleasure to moderate this next panel, which is a continuation, exact continuation of what we were discussing this morning. Panel leveraging evidence to support climate responses on multiple scales. And we will do this discussion as a panel and as I'm trying to engage between all of them and engaging you as well.
Today we have Katie Anderson from the Disease Control Epidemiology section in Philadelphia Department of Public Health. We have Dr. Raynard Washington, Director of Public Health Department in Mecklenburg County, North Carolina. Welcome to you both. We have Rodrigo Perpetuo, Regional Director of ICLEI, and we will explain what ICLEI is later on from all the way from Brazil. And we have A.B. Sullivan, Chief Resilience Officer of the Philadelphia Office of Sustainability. Myself, I am Manuel Franco. I'm a longtime follower of this house and these people. This is my fourth symposium on urban health and first pre-symposium. And currently I work at the Basque Center for Climate Change Research, trying to develop this research agenda of climate change and urban health. So my first question to you both, to you all four, is please tell us a little bit. I will tell something about you, you guys. I Google and search you all. I will be very gentle. You know, everything that bumps up on Google. Trying to explain how did you end up in these very relevant positions that you guys have from your previous background, and all of them have terrific previous backgrounds. So I will just highlight a little bit of something about each of them. So, for example, Dr. A.B. Sullivan, I know, oh, well, she's not a doctor, well. She worked previously at the Philadelphia Water Department, and I realized that you know everything about water nowadays, about green city clean waters, about coastal flood resilience efforts, for example. She was even a consultant for NASA for sea level change practitioners, and if I'm not wrong, you even train in water-related issues in Iceland.
Yes.
So, not a doctor, but a round of applause for all the stuff you did. So, please, Amy, if you could, in just a couple of minutes, tell us how did you end up in what you're doing these days?
Sure, I go first. Yeah, I have a really strange trajectory. I actually have a Bachelor of Fine Arts degree, so really studied art to begin with, photography and ceramics. Doesn't make a lot of money. I'm not good at self-promoting. I'm not a business person, so it didn't really go anywhere. I worked in museums, always loved science, went back to school for resource management, environmental resource management, studied coastal systems in Iceland, which was incredible. And then, yeah, ended up back in Philadelphia and started working for the water utility. We had a really fantastic green stormwater infrastructure program, still do. So I was very interested in that, sort of turning the city back into a system that could handle stormwater and soak it up with trees and vegetation with co-benefits. And then I kind of quickly shifted to working on climate adaptation. And since I had studied coastal systems, sea level rise, that was really an area I was interested in. So coastal resilience kind of became the area that I led on a very small team. And in 2022, I was with the water department for almost 10 years. And then in 2022, I shifted to the Office of Sustainability. And yeah, I've been in the Chief Resilience Officer role for a few years now. And yeah, it's my dream job. I really love it. So I'll stop there.
Okay, thank you. So following, now we go to Rodrigo, all the way to South America, to Brazil. Rodrigo is currently the Executive Secretary of ICLEI. ICLEI is a global network of local governments for sustainability. I must say that this is an impressive enterprise that right now it covers the whole world, I guess, ICLEI. No? And I have had the pleasure to work with different offices in Europe. He comes from the world of environmental sciences, economics, but very importantly, he has worked in very different levels, in government levels in Brazil. So please, can you tell us a little bit, how did you end up in your current position?
Thank you, Manuel. Pleasure to be here. Thank you, Drexel, and all the folks from Sala Urbal and the symposium for the invitation. So I was the International Relations Secretary for the city of Belo Horizonte. I know a few of you have been there. I have a colleague from there here also, Valesca, for 10 years. And on one of those years, 2012, ICLEI held the World Congress in Belo Horizonte. So I was the host for the World Congress that we have, which is every 3 years and gathers about 500 cities from all different parts of the world. And then the connection I had with ICLEI was in deep. I moved not directly to ICLEI, but to the state government of Minas Gerais as chief of the International Relations Department. And then on 2016, late on 2016, I was selected to be the executive secretary for ICLEI South America. And now we have ecosystem in South America within 4 offices. ICLEI as a whole has 27 offices covering about 120 countries and about 2,000 local governments in different scales. And we have an office in São Paulo, which is the regional and the Brazilian one, an office in Colombia looking and taking care of the north of South America, and an office in Argentina taking care of the south of South America.
Okay, great. Thank you for being here and sharing not only today, but also tomorrow. Go now to Katie. Katie, as said, she works right now at the disease control epidemiologist, and she just told me that she was part of the immunization campaign in Philadelphia. So big applause to that during COVID. I mean, so not on regular days. And she actually trained in this house. So can you tell us a little bit, how did you end up, and what are you doing right now?
Sure. So pardon me, I'm a little bit nervous because I usually sit behind a computer all day and just grind through Excels. But my bachelor's degree was in human health and science. So I wasn't sure if I wanted to be a PT or an OT or a nurse or what have you. I found that I was pretty good at stat, which I only dabbled in. And so I did an internship with the infectious disease doctor of the hospital that I worked at the time. And he was an epidemiologist. And I was like, whoa, I can make impact, but looking at numbers and help people without having to touch people. And so that was like really exciting for me. So then I decided I want to get my master's in public health. I wanted to do epi. I applied to some local areas in Virginia, which is where I grew up. And I applied to Drexel on a whim, thinking I'd never get in. And I did. So then I accepted, and then COVID happened. So I got to learn about public health and the impacts of what we do during a pandemic, which was really incredible. I got to help manage the COVID surveillance team at Drexel. So really got to apply data, test results, the variants, and how that was impacting our Drexel community at the time and what we could do to serve our population, especially our freshman groups at that time. From there, I knew I wanted to work in public health and work on a community level. I applied to a couple positions at the public health department, and I got a job at the Division of Disease Control, specifically public health preparedness. They also go by bioterrorism, but that's a little flashy of a name. And there I got to do the jurisdictional risk assessment, which was also paired up with work that professors and students here helped develop. And from there, that's where I got to do some work with heat health thresholds and warning systems for extreme heat, which I'll talk about later. And then I since got the position, my dream position, as an epidemiologist in immunization. So it really feels full circle to do what I do now and really try and help people using data on a community and local level.
Thank you very much. So we finally go to Dr. Raynard Washington. He actually did train in epidemiology, both as masters and PhDs in University of Pittsburgh. Great university. So many friends from trained there. And now, well, he worked also in the health as deputy health commissioner in the city of Philadelphia, and now he's currently the director of public health in Mecklenburg County, which is Charlotte, right?
Yeah, great. Good morning. I think it's still morning, everyone. Great to be here. I'm one of those weird epidemiologists that don't like to sit behind the computer and like to talk to people, so I'm a little bit different. And people tell me that all the time. So just very quickly, I'm a native of Richmond, Virginia, and I always start there because that's my home. And sorry, I just saw an old colleague. I went to school in Pittsburgh, has already been said. Worked in DC for HHS for a number of years, and then came here to Philly to serve as the chief epidemiologist and deputy health commissioner. I was here for a few years. And then on March the 14th of 2020, as I said earlier, I decided to move to Charlotte to work at the health department there. And if anybody remembers what was happening in March of 2020, that was not a great idea. But nonetheless, I have been in Charlotte now for about 5.5 years, serving as the health director there, where I get to work alongside about 900 folks to protect and promote good health there. I also add that I serve as the chair of the Big Cities Health Coalition, which is a coalition of the health commissioners, health directors from the 35 largest cities in the country. And together we work alongside one another to be able to protect urban health in this country, as well as to ensure that the priorities and needs of folks living in big cities are prioritized for both ourselves as well as for the administrations that we engage with, both at the federal, state, and local level. So great to be here.
Thank you very much. Okay, so after these introductions, the idea was to that you all know how complex and how different backgrounds actually relate to urban health, and are necessary those backgrounds to bring this evidence to support the necessary responses at different levels in our administrations. So my first question goes to Avi. So if we are to work in complex issues as climate change and urban health, we need to work in intersectorial work. And we would love to hear, how do you manage to do that in collaborating between city departments in your kind of job?
Yeah. So just a little context setting, the Office of Sustainability is pretty small. We're up to, I think, 28 people now, but about half of those work on just energy, mostly on municipal energy, trying to manage our emissions and our energy portfolio. We have an environmental justice team. We have a climate solutions team that's really trying to lower emissions for residential and commercial, anything that's not city owned. And then we have our resilience team. We have 6 people on the team now, and then I'm leading them, but have a fantastic team, and we work at different scales, and we work on everything from protecting neighborhoods to also thinking about infrastructure. So we kind of span, a lot of different work, and a huge part of what we do is interagency coordination, right? There's a ton of fantastic work happening at the health department, at our water department, at our airport. There's lots of preparation happening, but our role is really to try to coordinate that work, making sure that people have the tools and the resources, the climate projections that they need. I also do a lot to work with researchers. So there's a number of larger research projects that we're part of and that we work on. And I do think interagency coordination, though, is a huge part of what we do. We have an environmental justice and climate resilience committee that has 14 different departments across the city. We come together quarterly, and then we have working groups in the months in between. We have a citywide flood risk management task force that's also organized by my team. That's also 14 different departments that touch on flooding and flood risk. Lots of work happening with that program. We also have, there's an excessive heat steering committee. So that's all the departments that sort of touch on excessive heat. We don't run that one. That's really led more by the Office of Emergency Management and Health. But there's a lot of work happening across departments to make sure we're coordinating and using the correct information and aligning what we're doing to try to save resources. So it's a huge part of my job. And I'll just say, I think we really value research and try to make informed decisions. We're a small office, like I mentioned, so we're really about developing policies and programs. We do some pilots to inform infrastructure decisions, but everything we do, we try to base on, data and results and assessments so that we're data informed and, trying to connect all those dots and think about the intersectionality of all of it. So.
Okay, next question goes about how connect the data and those dots goes to Reynard. And following the previous panel, where do you see the challenges and opportunities for collecting the necessary policy, but also research data at the city level? So we need environmental data, health data, socioeconomic demographics data. How do you see that from a US perspective? And if you want to address something to outside the US?
Sure. How long do I have? I'm just kidding.
3 minutes and a half.
So I think there are a lot of challenges. I think we all know that the disconnectedness of our data systems that exist across all of those intersections you just described are the biggest barrier to us being able to ask and answer questions. We don't have great information at really any of those levels. You have healthcare information that sits in one silo, you have information about people's lived experience and communities and social economic drivers, maybe in another one or maybe not at all. And then the information we have about what's happening with environment continues to be fragmented at best, but really limited. And the level at which we are able to capture information remains too high. And so you don't really get a strong sense of what individuals' experience is, because we're capturing monitors that cover large geographic regions that don't speak necessarily to what's happening for any individual. So lots of challenges there. I think the earlier speaker mentioned the issue of sort of administrative boundaries and our over reliance on those to understand what's happening in neighborhoods and communities, and that also truly across all of these intersections remains an issue. But I do think there's some examples of progress on the environmental front. I know we here, when I was in Philly, worked to expand the air monitoring system pretty significantly. A similar effort is taken underway in the Mecklenburg County, Charlotte region as well, and it is regionalized as well, so it's not just in our county, to be able to expand the number of monitors we have so that we can get more granular in our data. We also have launched a health information exchange in the state of North Carolina that, again, I think HIEs were really exciting 2 decades ago. I think we are still trying to figure out how to make that excitement come to life. But I do think it's an opportunity still to bring to bear some connectedness of information about health and socioeconomic status in one spot. And healthcare utilization as well, which is, most of our data on healthcare utilization is highly delayed. So you're looking, several years out. And then one project I'll mention before I stop talking about this is in Charlotte, we were part of a national effort to be able to sort of improve environmental monitoring and assessment. And this was a research study. I forgot exactly who was funded by, but it allowed teams of about 60 workers to go out into neighborhoods and communities in vehicles that had monitors on them, both monitoring for temperature as well as air quality, and to cover the ground in those communities and create essentially a Charlotte environmental map for the region. And this was a part of a network, I think, of about 40 different cities that participated in this. And so, again, this was a one and done. It wasn't sort of a routine monitoring effort, but I do think those kinds of opportunities, testing the technology to say, can we do this? And then figuring out ways to institutionalize that, to do it on a regular basis, becomes a part of the conversation that we need to be having with folks who have resources to invest in this kind of space.
Thank you so much. Very interesting, your experience. Back to Katie. You work as an epidemiologist, trained as an epidemiologist. That sounds very data intensive, data oriented. So how do you see how much that quantitative or research evidence in general can you bring or is actually used on your daily work at the department?
Yeah, so I'll speak to a specific project that I did and how the kind of granularity data that I was using impacted some policies that we have been using even this past summer. So just for context, a couple years ago, I did a retrospective analysis and evaluation of our PDPH Philadelphia Department of Public Health early warning system for extreme heat. The warning system was initially started in 2017, but we wanted to make sure that our heat index thresholds that we had to deploy this warning system was still up to date, and that with climate change, we didn't need to increase the heat index in any way or tweak them. So I did a study of basically my own, looking at our warning systems, which we have a heat caution warning, and then we have a heat health emergency warning. So the heat caution kind of just gets our partners ready and on standby, and we send out messaging. And then our heat health emergency is what deploys or activates our cooling centers and our clinicians that are on staff to receive any calls on hotlines to help people get some sort of access to clinicians to see if they need to go to the ED or how to prepare for heat. So that's why we had the warning systems in the first place. And really, heat is the major climate related health hazard. And the risks are not evenly distributed. You know, we have older adults in Philadelphia that are affected, people with chronic health conditions, we have unstable housed individuals that are deeply affected by extreme heat. So we as the health department wanted to provide equitable access to cooling centers and places for people to receive access during those times of stress and heat stress. So that kind of goes into like the policymaking aspect of our policymakers wanted to know when we needed to deploy these things and at what level. And that leads me to back to 2017. Prior, PDPH relied on the NWS, the National Weather Service alert systems, but it didn't seem to really serve our population and the health outcomes that we were seeing in the EDs and with the mortality rates. So I did the analysis, looking at mortality and emergency department visits for Philadelphia, and then compared that to when we were deploying our warning systems, which warning systems, and what the heat index was during those periods of time. So my findings were that the heat has both a same day with ED visit emissions and also a lagged effect, specifically with fatalities on the health. So just for context, there's a lagged effect on health due to heat. So usually when there's a spike in heat index, it usually takes 1 to 2 days for the body to really start to experience heat stroke and exhaustion and things like that. So as a result of that finding as well, we decided that in the early summer, May and June is more dangerous because our bodies haven't acclimatized to that heat. So if we're seeing a jump in the heat index in May and June, we're going to have a higher kind of frequency of ED visits and even fatalities. My findings also looked at how a multi-day like heat wave or compounded risks, so going from a heat advisory, and then a few days later, increasing it to a heat health emergency, meant that there was just a long period of time where people were exposed to heat. Therefore, the spikes in ED admissions and fatalities spiked as well and lasted longer and compounded for those combined times. So with the policy transition as a result of the analysis that I did, we found that that lowering the thresholds for heat index in May and June was definitely a best practice because, again, our bodies aren't acclimatized. So if we lower the thresholds for May and June, we will deploy them more often or more accurately in May and June, and those resources can be provided to people, as well as extending our emergency declarations 1 to 2 days if our capacity allows it when there are back-to-back heat health emergencies that we're announcing within the span of a week or 2 weeks, just to allow people to have those resources for a little extra time, even if the heat index isn't meeting that specific threshold. So I'll just cover the challenges real quick about the policies that with policymakers, you know, they need clear, actionable thresholds. And as an EPI, I have to translate then very complex data into decision-ready guidance and more like hard rules. So with the broader lessons from this analysis that I did is that evidence
only moves policy when paired with partnerships and communication. So for example, we changed some terminology to be like heat health emergency. That word emergency really engages people, and really defining what emergency means. If it's an emergency, that means we're deploying cooling centers, we're deploying the hotline, people have access to things when it is very hot. That means it's super, super hot, and people have resources that they can use during those times. We also made sure to collaborate with agencies like OEM and community organizations. Before the summer season would start, we would always send block captains, kind of the champion of their neighborhoods, mail outs on just how to prepare for summer and explaining what these thresholds mean. And then just summarizing, as an epi personally, it's my job to be a translator. So to turn messy, nuanced data into something that's actionable and to really keep equity at the forefront of what I do.
Very, very interesting. To make a little bit of context or European context, this summer we had our first heat wave in June, at the end of June. Then July was unexpectedly mild in Madrid, and then we had about over 20 days of a heat wave in Madrid in August. So it was the longest heat wave, and it was, well, it made a lot of problems in Spain. Actually, in Bilbao, where I live right now, we peaked to 42 Celsius degrees, which had never happened in Bilbao. So everybody's like, and then the data, the thresholds that you were saying, and the translation of that into local decisions is still something that, at least in Bilbao, we don't know anything how to deal with it. So from Bilbao to Brazil, Rodrigo, given your experience both in local administration and regional projects, can you share a little bit of your experience on multiple scale governance and how that bring that to urban health policies?
Yes, Manuel. Well, I think we see a very challenging world right now, in the sense that we need the global decisions, because they frame the institutional perspective, but also the regulative and normative perspective as well, in different scales. First, at the national scale, when a country internalize and approve a treaty or agreement which it has signed internationally. And then from that national perspective, of course, for the state or municipal perspective as well, bringing in the framework that the local governments have to respond to. And this takes time. So sometimes we get this sensation of frustration, because we see a global conference like the climate conference coming to Brazil this year, to the city of Belém, the COP30, with some agreements that will then take time to take form in the local level. So what we see here in terms of the health perspective is that in terms of climate change, it's actually emerging perspective. Unfortunately, this is not a perspective which is dominant, nor a perspective which is in the center, in the core of the climate change discussions and even regulation improvements, at least from the local government's advocacy perspective. So I guess in the end of the first panel, we did have that strong message of how we are communicating. The data is very good, sometimes complex for a local government to read and to appropriate, but there is data, there is very good information on the consequence and the effects that should be shaping up also the negotiations at the national level, but also the pressures that are coming from the local level. Then there is the other side of the coin. What is being done on the local level can also influence the norms, the legislation, the regulative aspect also in different scales, from the state to the national and to the international perspectives. And there is when the associations, coalitions come as an important entrance door for those changes that are required. If a city goes by itself to
state or to a national government or even to an international negotiation, it would be very difficult for this city by itself to provoke tension or change in any level. But if a local government comes with different pairs, even from different countries, with a strong argument, then it is feasible to expect attention from the different stakeholders and even change from the regulative perspective in international agreements. So there are the possible change also from bottom-up perspective when there is leadership and united voice to do so.
Thank you very much. Very interesting as well. Okay, so now I have an open question to the four of you. We live in a world of rising social inequalities, being at the country level or the city level. And we would love to hear from you one relevant experience working with vulnerable populations in relationship of or in relation of climate change and urban health. And please, you feel free to talk to each other or make questions, make all the tough questions. I cannot make the tough questions, so you can you can do it yourself.
I'm happy to get started. I will say, in Charlotte, we have an environmental leadership action plan, which essentially was driven by a group of residents who said, this was 20 years ago, the county needs to prioritize preserving our environment. That translated to the government launching an office, not of 26, but of one, that does everything that her office of 27 or 28 does, and really sort of spearheading both the environmental justice action plan, a leadership plan that really involves a lot of aggressive steps that the local government's doing to be able to ensure that we preserve the environment in our community. That includes a land acquisition strategy, as well as ensuring that there's response infrastructure for environmental threats that might emerge. I think where, and that's making great progress, highly successful, very expensive, but it is certainly a good example of a community prioritizing this issue and making some real investment, including moving all of our vehicles to EV, as well as I mentioned, a pretty aggressive land acquisition strategy to preserve parkland. Across big cities, though, I would say the area where we've probably had the greatest amount of traction, attention, and success is in this heat response. There is a lot of growing appreciation for the importance of communities having infrastructure to be aware of emerging threats related to heat, but also to make sure that we're prepared to respond to them. And so later this year, we convene twice a year as big city health directors. We're going to Maricopa County, which is Phoenix, and they have really played a strong leadership role in understanding, obviously they have a lot of heat there, but having a pretty aggressive robust response system with early warning, as well as a comprehensive community partner strategy for education awareness, cooling stations, et cetera, and are using data to help them understand how to drive not just the planning and but the actual response itself. So placing cooling stations in those communities that their environmental data is showing are already disproportionately impacted by other climate threats, as an example of trying to use information to drive strategy on the ground. And so there is a lot of traction, I would say, right now around heat. I think the opportunity is for all of us, is to think about both research and practice, is how to close the gap between everybody's paying attention to heat because it's easy to measure the impact of it. We can say when someone's gone to the hospital, that's a very clear outcome that people want to avoid. How do you connect that through line to every other factor driving the heat is what I think is difficult for policymakers to really understand. Okay, I get that it's hot outside and people are going to the hospital. How do we have a way to respond to that? But how do we draw the other things driving the increased heat to be a priority for policymakers is a big question for us, right? How do you get legislators to think about, okay, it's where we place factories when they're dealing with the demands of the business community. It's the way we place roads. It's the way we build transit or not build transit that impacts our ability to be able to protect the environment. And so figuring out a way, and these are things that we don't have as readily available hospital healthcare indicators that they that are alarming for them, we talk about it. But so figuring out how to quantify it in a way I think would really be helpful. And I think it will take a partnership between both practice and research to help us understand what are those easy to understand indices or outcomes that we can sort of tell the story of how is climate and environment impacting health in a community, and here are the tangible things that we can do to reduce that. I don't think we have a clean story, and I think that's why it remains not as tense as it probably could be. I think some communities, there's a lot of tension around climate change. There's folks wanting priorities that are focused on reducing emissions. And then other places where this is just not even a topic of discussion. And so I think we've got to figure out one city doing this by themselves, as was mentioned already, and a big landmass of other cities not doing it around them doesn't really have the kind of effect that I think we want to have. And so you've got to get everybody in conversation. The other thing I was going to mention earlier about data is that people move a lot now, a lot more than they used to. And so I think we have a complicated equation of trying to figure out what a person's exposure is. And so on the research side is, to the extent that we can do a better job of measuring exposure at the individual or community level, I think would give us an opportunity to have a more cohesive story. Because again, those just relying on administrative boundaries is not going to get us, I think, where we need to go. So.
Who wants to go next on the experiences with working with vulnerable populations?
Maybe I'll go because I think it follows up on a lot of the pieces you just talked about. So my team works at different scales. We think of ourselves almost like nested Russian dolls. So we do citywide work. So I'll give an example at each one of these scales. So we do citywide work, then we have programs that focus on heat and flooding, and then we have what we call our place-based work, where we actually go into communities and work particularly with frontline communities, those that are most vulnerable and hit first and worst. So at the citywide level, right now we're in the process of updating our city's resilience plan. The first one that we published came out in 2015. I think it's generous to call it a resilience plan, but it was a great start. But we need to do better. We're making it citywide. The first one was really just, here's what could happen to departments where they're vulnerable and a few things that we could do to improve. We're making it citywide. We're including stakeholders across the city, and we're really focusing on those frontline communities. And so a large reason why it's taken so long to get this plan updated is that doing public engagement across the city of, a city of 1.6 million people takes a lot of resources. And to do it well, where you're translating and interpreting and working with community groups and paying them for their time, having childcare, having food, takes a lot of resources. So we've been fundraising and looking for philanthropic support for many years. I feel like we run like a nonprofit, honestly. So we're finally kicking this off. Right now we have an application open to work with 18 different community groups across the city. They're going to get $10,000 grants. And really what they're going to do is join a cohort to sort of get some training about climate change, about civics, how you make change, power mapping, those types of things. And then working with them in their communities to reach those frontline communities to get their input into this planning process. So that's one example. In preparation for this resilience plan and actually coming up with the solutions and the roadmap of what we want to do, we did a heat vulnerability assessment. We also did a flood one, but I think the heat one is probably more interesting from a public health perspective. We put out a survey. I think we got some interesting results. We had never had information about some of these questions, like who has access to air conditioning? If you have it, are you using it? Can you afford to use it? Are your utilities shut off because you can't afford to pay them in the summer months? So we got some really interesting results. Not surprising, 86% said they do have air conditioning. However, just about a third of those respondents said, I have it, I even use it, even though it means I won't have money for food at the end of the month. So I think these are things that we kind of assumed, but we didn't actually have results and data to show us that. 15% said they or a family member had been hospitalized in the last summer season. It was way higher than I thought it was going to be. 16% said they had shutoffs in that last summer season we said between April and November, because Philly can get hot in all of those months. And an additional 12% said that even though they didn't have them shut off that last heat season, they had them shut off in the past. So I think there's a lot of great results I could share, but I'm going to stick with that. We also did an assessment high level to understand how temperature increases will change air quality. So if we look at the air quality days that we have today with temperatures increasing, what might that look like in the future? We also looked at heat impacts on our grid, which I think has also really big implications for public health and all kinds of critical services. Really quickly, we are also doing sort of citywide, trying to work on policies related to heat, and we're doing a couple exciting pilots. One is a cool pavement pilot. We're working with the University of Pennsylvania students in 2 different labs there. Really interesting with cool pavement, we were taking all these measurements. We were doing surface, air temperature. We're looking at how the material is holding up in our climate, because we do, we have to pave, we have freeze thaw cycles, we do salting in the winter. So very different from the Southeast and places like Phoenix, where they've been using this as a tool to, help cool their different neighborhoods. Great results saying that this material works really well. Well, then we started working with another lab who measures mean radiant temperature. So it's not just the air temperature or the surface temperature. It's really looking at how the human body would experience that heat. And what we're finding is that at certain times of day, it actually could make a human that's standing near it hotter, right? So we need to think about, is that a solution that we want to pursue, or will we better spend our resources doing a cool roof pilot where there's no humans standing on top of it if it has the same impact? So we are also doing a cool roof pilot. And that brings me to our place-based work. We were the first city, I believe, in the nation to do a community level heat resilience plan. We did that in Hunting Park, which is our hottest zip code in the city. That was several years ago. That kind of sunset it, and we're really excited to see community groups now like Esperanza really taking over that work and getting EPA grants, some of which are now terminated, but really stepping up and doing fantastic work. We're now doing a heat resilience initiative in Strawberry Mansion, another very heat vulnerable community. We're doing lots of different things there. I don't have time to talk about it all, but we are doing a cool roof pilot there, and also potentially working with a Drexel research lab there to better collect the data, and working with a really important partner, which is the Energy Coordinating Agency. So those examples at different levels of how we're working with vulnerable populations.
Thank you very much.
Abby, you mentioned the HVI, the Heat Vulnerability Index. So my one colleague, she works and helps upkeep and is looking into re-upping kind of the variables of the Heat Vulnerability Index. She got the HVI is what we call it, and I got the heat thresholds, but the HVI has been super useful in our work to then serve the community and identify spots, neighborhoods where we need to do outreach, do canvassing, knocking on doors, providing information about heat, and then doing info desk sessions with in communities, and also identifying if there are any gaps within communities where there could be a potential to open a cooling center, i.e. use a building that already exists or a library that already exists to serve as a cooling center, and why kind of the HVI and the outreach work that we do is so important is because the limitations of the work that I did, of even though the thresholds are super important, it's gathering weather data that's just from one weather source or sensor for the whole county of Philadelphia. So even though the data and the thresholds and the warning systems are really great and impactful, it doesn't provide any community level, street level information. And that's where the Heat Vulnerability Index really fills that gap for us. It measures the vulnerability of individuals in our population within Philadelphia. It also looks at other kind of heat related factors and environmental factors, such as kind of identifying loosely like kind of those urban heat islands. So then we're able to have a heat map of our city and see, based on the colors, where there are spots where we really need to focus our outreach and our canvassing efforts to get those vulnerable populations the information they need. So then when we do send these flyers, and when we do send out these alerts, that they know what it means and they know where they can go locally to receive those resources.
Wow. So from Global South, South American Global South perspective, maybe things are more dramatic, because then you have, of course, you would have in the US, in Spain as well, but you have a structural perspective, which means that about 20% to 30% of the city population would live in informal settlements, favelas, which means that they don't even have a proper house and they don't even have sanitation, for instance. So this is the face of how climate change is impacting vulnerable population in the Global South. It brings us to the connection of agendas: the climate change agenda, the biodiversity agenda, and the urban agenda. Those agendas at the global level have different channels to follow. UN Habitat with the urban agenda, UNFCCC with the climate agenda, and the Secretariat for the Biodiversity Convention for the biodiversity agenda. So there is a fragmentation from the global perspective that is reaching, and AB and the colleagues mentioned the challenge, which is the effort, which is to work within interagencies or interdepartments daily and currently in the city administration perspective. So this is the basic challenge. And then there is the conjunctural perspective, which is when comes an extreme event, such as strong rain or a heat wave, then potentializing that fragility at the most. So this is very, this then gives us the perspective that to address the health and the climate perspective, we need urban interventions in a scale that the cities by themselves are not able to draw and to prepare, and not even able to finance by themselves. That's why the multi-level perspective is so important in that sense as well. And then if you look at the nature perspective, those vulnerable areas are where there is no parks, no trees, no planned occupation. So when there comes a heat wave, it hits that population at the most. They have old cars, so they're emitting more. They have no air conditioning at all. I mean, it is a very fragile perspective in our case. But there are programs. So the Brazilian city ministry, there is a Ministry of Cities in Brazil, and they have this program in Portuguese, and the Spanish speaking maybe will follow a rough translated. It is Periferias sem risco, favelas sem riesgo, or vulnerable areas or informal settlements without risk. So they plan interventions that will tackle the urban perspectives, structural ones, the biodiversity gaps, and of course the social dimension of them all that will bring, of course, the health in first place. They are able to intervene in 64 favelas in Brazil right now in this year, which is not much. We have 5,570 cities just to speak about Brazil. So this is the kind of program that would need a massive task force of financial resources to bring in to the national government to support the project designing, maybe with the help of the support of universities in the cities, the city government, of course, and then the interventions. This is a 10 to 20 year program to
bring the change in the dimension that it is required to improve the conditions of life of those people who are living in those favelas or informal settlements. And of course, the data on health, if we have the data on health applied to that favelas, we could do more advocacy to the financial institutions, to the UNFCCCs in every of the one pillars that we have that are driving them the national priorities as well, and then the finance perspective of the public policies.
Thank you very much. So interesting as well to hear your perspective. So you didn't interrupt, or you didn't make tough questions to each other. So I will continue with the questions. My final question for the four of them, and then is your time. Maybe you can do the tough questions. Will be, what is your current and main concern about bringing the necessary evidence to support climate responses in these multiple scales? So if you can try to name one main concern from your perspective, and for this case, it's great to have heard all your different approaches and backgrounds and ideas. So what would you name as the main concern nowadays?
Now I will start because it's very hard to be the last one with this very good group. Well, I think the main concern towards the usage of data and evidence is the false dilemma and cause and effect. If you see the data, and this of course would be repeated in different research work, the data is looking at the effect much more than the causes. And we need also to bring in a better tie on those. I think that there was two closing remarks on bringing more economical and social data attached to those health data that are already being provided, and also communicating it better, because even the people who are suffering from health issues due to climate change do not know that. So they do not pressure the government to take measures to improve their quality of life in that sense. And then communication is already, is again a very big issue. So there is in the top level of this challenge, the lack of very effective advocacy towards the bodies that should be taking this kind of information into consideration in their very important decisions that will affect policymakers 2, 3, 5 years later. And I think this is probably, in my perception, something that we could together figure out how to improve and how to, in the short term, change and bring it to another level, different level of influencing decision makers in the international and of course in different scales to increase the possibility of tackling this connection of health, climate change, and biodiversity.
You said one thing? Okay. I guess the thing I would say as a local health official, for me, that's probably most top of mind is really the policymakers themselves. I think the unfortunate reality for us in this country is that politicians have weaponized things like climate change and public health in general, and CDC and vaccines and other things as a part of political agendas. And so it makes it very, very difficult to cohesively communicate facts and data in a space where it's the trust has been compromised across the board. And so I don't think we make any significant strides without figuring out how to, as I mentioned earlier, communicate in simple terms risk and ensure that we are measuring impact to be able to tell the story. Else we will continue to be talking amongst ourselves if we don't do that.
I mean, I was gonna say a similar thing. I think it is chilling seeing what is happening at the federal level right now. You know, I work with global climate model data. I work with the Department of Energy. I mean, the compromises that are happening, the colleagues I have at NOAA and NASA that have been let go or chose to leave, like this is going to have ripple effects for generations. And to see research funding cut, like this is stuff you can't get back. And that trust, like my office is wondering if it's even worth applying for certain grants because we've seen them terminated and the money taken away. I mean, that trust between different levels of government, between, you know, we work with community-based organizations and we re-grant funds to them through these environmental justice grants from the EPA, and they're now terminated. I mean, it really has these horrible rippling effects. And I think we needed more leadership than ever right now. And instead we're seeing, you know, complete destruction of all of these systems that provide really important information. And yes, there's great modeling centers in Europe and other places, but the US has been a leader in the space. And I think we're seeing brain drain going to other places. And it's pretty terrifying, if I'm being frank. Yeah, I agree with all that. Big bummer for sure. On top of all those things, like one thing, speaking from my perspective, working with local government, is that we've really never received funding purely devoted to climate change. So anything that we do that's climate related, we are fitting into the work that we already have to do to complete and prove that we deserve these grants and uphold the grants that we do get, which is a battle in and of themselves, you know, with what's going on with the federal government. But with all that being said, I want to emphasize that the work that we do is so important. And I don't want, you know, young people who I used to be not too long ago, a student here at Drexel, to ever feel deterred by what's going on with this federal government and what's going on in the world. While it is, you know, not fun with seeing what's been going on this last year on the federal level and uncertainties with grants, we're still able to do these heat thresholds. We're still able to go out to communities and make a difference. And just us doing that alone is an act of resistance and an act of, you know, devoting ourselves to the community and the work that we want to do. So, yeah.
Well, thank you very much. These not easy reflections that you spoke right now sometimes happen also in Spain or in Europe. Not every country in Europe or not every region in Europe has progressive politicians or governments. So, and sometimes universities are the only place where we can have these conversations. So we are in the same boat somehow. Okay, so thank you again to all of you. Now is the time for the tough questions, and we have plenty of time, I think. So, yeah, please.
Thank you so much for a great set of presentations, very illuminating. I wanted to ask about the governance aspect of dealing with climate hazards. So you all talked about interagency coordination, but I wanted to go just a little further, given that climate hazards involve heat, but also wildfire air pollution, flooding, and that probably translates to Parks and Rec Department, planning, housing, transportation, public health. What are some of the biggest challenges around governance? Because the decision power sometimes lies in these other agencies whose missions are probably not as well aligned with climate as we'd like them to be. So what are some of the biggest challenges and maybe the solutions that you think, if you could kind of snap your fingers on one thing that could be done to allow you to improve the governance around climate and health? Thank you.
Yeah, you guys are putting us on a really bad spot with this one thing list. I'll just say, I guess to talk a little bit more about it, in most jurisdictions, there is an Office of Emergency Management, and typically that office has logistical governance over any kind of response to either extreme heat events where you've activated your emergency management infrastructure, or a hurricane, or extreme flooding. They typically serve as kind of the convener of the interagencies that are responsible for any aspects of that response. And depending on the nature of the emergency, someone will have incident command and will have ultimately authority to help make decisions. This largely focuses on the response, though, so this isn't as much about sort of policy change. It really is about in the moment, as something is going on, you're activated, how to respond. We activated these for COVID. We activated these for Hurricane Helene and over the summer when we had the heat wave as well. That they bring together all those partners as a part of the infrastructure there. There's a very rigid sort of system for how that's managed. There's coordinating arms to state government, as well as they bring, federal agencies, FEMA, to the table as necessary. So I do think that that's actually an example of structure that exists here that's good. And I think most communities do it. The trouble is sort of the scale, right? So in smaller communities, the infrastructure available to even pull together is not there, and so you lose some of the value of that system if you're in a smaller county. So again, I represent a big city, so we have more infrastructure, but just over the border in South Carolina, it's a very different story, right? So, and as you all know, weather events don't happen just to one county. So when it comes down to trying to respond to a weather event or an extreme heat situation, it is the disparities that exist then across, and in this case, it's advantageous to be in the big city because you have more infrastructure, but you do start to see very clear differences in those areas. So there is some governance that exists. I think that's an actual good example of something we figure out well here. And I think the opportunity we have, we talked a little bit about federal policy making, but a lot of this is managed by states. And there really is a lot of variety in how states approach this and manage it. And so make no mistake, there's a lot of attention right now on federal policy making, but there's a lot of state policy making and decision making that has really consequential impacts on our ability to be able to manage to anything related to health, but particularly in the climate change space. And response space. And so I do think also, having improved coordination across states, particularly those that are neighboring, could be a real opportunity for us to think about how to govern response activities so that what happens in California doesn't look grossly different than what's happening in Oregon. It doesn't look grossly different than what's happening in Washington when they're potentially all dealing with the same event.
Very quickly, because this is a very good question. I will speak from two different reference. I was chairing the state climate change committee back there in 2015 for 2 years, and we do recommend governance structures to all members or improvement of those structures. And maybe what I can bring into the table is that first, these kind of committees, they tend to lose power, and maybe not the response ones. I mean, there is the specific regulation for the response piece of it, then the policy piece of it mostly. They tend to go to a secondary level very quickly. Once they're stalled, all the secretaries, the leaders, maybe even the mayor, the governor are there installing it and being involved with the first activities. Then when it comes to regular basis process, they start to delegate to the second level, to the third level, to the technical level, which loses the purpose of that governance committee, which is bring the issue to a political institutional level at the highest perspective. So it's a challenge to keep up the institutional level at the top frequently. But then there is the technical challenge as well. Sometimes different departments have knowledge asymmetry on what is to bring in climate change mitigation and adaptation to their own sectorial finalistic policies.
And then there is a constant necessity because people change from jobs to jobs and governments change every few years. So there is a constant demand to provide technical capacity so that those technicians can appropriate on how to embed climate change on the sectorial policies on both perspectives, mitigations and also adaptation.
Hi, thank you so much for a really engaging and interesting panel. With a lot of examples of kind of policies, which I really appreciated. And I think you mentioned recently just now about mitigation, and I kind of just wanted to talk a little bit more about like, you know, the link between urban health and mitigation. And, you know, we spoke about kind of emergency management and disaster risk resilience, kind of one aspect of urban health, but also thinking about mitigation, how policies around congestion pricing or, you know, heat to electricity conversion or, you know, those kind of, you know, carbon emission, cities are the major source of carbon emissions. So kind of, is there ways to kind of integrate thinking about mitigation and adaptation? Because I feel like disaster risk resilience is kind of a field in itself, and a lot of this work on kind of emergency management fits into that. But where does mitigation fit in?
I can quickly start and give a shout out to, there's a team in our office called Climate Solutions, and they do a lot of work to mitigate. And that's that crossover with our team working on resilience. So a lot of what we do is trying to work at the household level, trying to first seal up the home, because in Philadelphia, they're very drafty, they're not very efficient. So seal up that home, then think about replacing the system and making it more efficient, electrifying. And then step beyond that, can we get solar and battery storage so that they're resilient if an event comes through, right? So there is that real crossover in making the home more efficient, you know, reducing the impacts of climate change, reducing those greenhouse gases, also, you know, reducing energy poverty. So Philadelphia has some of the highest energy burdens in the entire country. So this is like a key issue here. And I think there's a lot of really exciting housing programs through the Energy Authority, through our Department of Housing and Economic Development. We have, and with our partner PHA, who does implementation, there's a basic systems repair program. So it's exciting, I think, to see. Our office is working on a property level flood mitigation program. So there's really been this shift, and I don't know if you'd agree, but I feel like when I first started working in this space, it was like, well, yeah, duh, people need help in their homes, but it's been really exciting to see municipalities now stand up these programs to actually give people that support. So.
Yeah, we have a number of similar sort of individual level interventions in Charlotte, but as I mentioned earlier, we have the Environmental Leadership Action Plan, and there are a lot of reasons why we can't necessarily pass local policy to restrict emissions, and it's out of our jurisdiction. But what the county has done, sort of as a sort of alternative to that, of being able just to pass policies and restrict emissions, is basically committed that we would become carbon neutral as an organization, and as an extension of us and our subcontractors will become carbon neutral. So I mentioned earlier, there's a 20-year plan to move all of our vehicles, even our fleet of transportation vehicles, to electric by over a 20-year period. Our staff don't like it a lot, but it is it is what it is. As well as the land acquisition strategy to preserve natural spaces, and then also just our buildings. Do you think about local governments? We have all those school buildings. All those buildings are potential sources as well. So making those buildings as efficient as possible. Again, it's about the local government's locus of control, and then also some community level interventions, the solar, supporting families and households to get solar panels or convert to solar or other alternative forms of energy, but also just installing free public EV chargers, which I know a lot of cities have done, again, as a means of trying to encourage people to adopt cleaner alternatives, all things that the community is doing, among a few others.
There's another question up there.
Maybe very quickly, because there is a difference
also between mitigation in the developed countries and the global south. I mean, if we look at the global south, no city is reducing emissions at the speed that they should be reducing. All of them, most of them are committing to be carbon neutral by 2050. And this is very easy for a mayor whose term is ending in 2029. I mean, this is a very serious issue no one is speaking about, because if you really look at the JT inventories at the city level, I'll speak for the global south, when there is a reduction, it is due to some external issue, economical crisis, COVID, and then economical crisis, or something very particular in that city. Other than that, there are very few genuine, efficient efforts in sectorial policies such as transport, buildings, and maybe nature as well, that will reduce constantly and in the speed that it's needed the emissions. So this is a very big issue that we should maybe illuminate as well.
So thank you, everybody. This has been fascinating. The first panel this morning, a lot of discussion about new sources of data, but all of the discussion of the role of the data was all about advocacy and making the case to federal government, to legislators, and motivating action. A lot of the talk in the second panel, where you come from local governments, where the formally empowered actors are government departments. The role of data has been supporting operational decisions and planning, and it has been a different kind of data. And so I'm curious if you could maybe articulate something about sort of the role of data in terms of who the actors are, what kinds of actions that you're using it to support it for. And I also noted that the kinds of data that Abby in particular talked about, that was this very expensive kind of data to collect that, that comes through this very intensive effort to, well, you talked about it. And it's really great that Philadelphia can do that, but not all cities can. And so what are the options for cities that don't have the resources to collect that really specific local, hyper-local, very specific local data? That's it. Thanks.
Yeah. I can speak to kind of the struggles of getting data because at least where I work, we can't get expensive data. We can only work with the data that's already being captured somewhere with a contact that we have that's willing to create a legal agreement between us and all parties are okay. And then we get what we can get and figure it out from there. And I think that's kind of a big kind of mountain to climb when being an epidemiologist within the public health department, is being able to get data that is mostly complete. That's the hope. It's never going to be fully complete. But the key is to really have connections with other programs or other divisions who are willing to either provide or come up with an agreement of sorts, or even just de-identified data. That's a lot with what I was working with for some of this heat thresholds data for mortality. That's kind of been our connection, is getting what we can get our hands on that's already being captured for something else. For example, the ED data was already being captured. There's a surveillance system that is just capturing who's coming through the ED, and mainly it's for a disease lens to kind of capture the indicators of who's coming in with to the ED for, it's kind of the scarier disease level stuff. Are there flags for, are people coming in because they're worried that they're exposed to rabies? And then it's like, okay, is there a rabied animal in the area that then the other program has to go find and address? So like having kind of already access to that data, we could put in heat indicators and then kind of pull that information that way. So really kind of reworking what data systems are already capturing information, and then is that enough information that we can rework work for a project that's slightly different. So that's kind of an example of how we are able to work with what we have in order to come up with some meaningful outcomes. I'm going to say something probably all of you are going to hate. I don't know that, like, we're at baby steps. I don't know that we need crazy studies. Like, we kind of know what some of the basic solutions are. We don't need more data to show, like, we need to plant trees. We need to, white roof coatings work. I mean, there's some areas where with infrastructure, there's a lot of things. And I don't mean to discount, like, I love research. Everything you guys presented, I was like, oh my God, this is incredible. I love it. But there are so many basic things that you can be a county that's not doing this crazy assessment, and you know what has to happen first. And I will say, so much of this work and beyond climate change is just tied to poverty, right? Can we just, I feel like addressing poverty would solve so many things in public health, whether it's climate related or not. And so the more I work in this space, the more I come back to programs and thinking through policies and ways that we can basically raise people out of poverty. And that gets really tricky, right? Because then it comes down to economic development and housing. And sometimes those goals can be at odds with climate goals. And so it does get really tricky, but I think that's just my 2 cents.
Yeah, I'll just quickly add. I think I said it earlier, and maybe it's just too simple. But we just got to be simpler, right? We're talking about things that are complicated, and yes, it's great to make lots of cause and effect associations. It's great to do new cool things with AI, and it's great to do a lot of things. But when you think about the current climate in which we exist and the conversations people are having, there's a demand for attention in every corner of health and everything else, right? So we've got to figure out how to communicate as clearly and concisely as possible about the issue. And in the case of climate change, because of my comments earlier around how it's been politicized, you maybe don't even call it climate change, right? Like, we don't have a climate change plan in Charlotte. We have an environmental leadership action plan, which, does it sound any better? I don't know. But nobody gets bothered by it, right? Because it's about how do we improve the environmental conditions in which our residents live. And it's not about that bad word, climate change, that's become a bad word for no reason. So I do think that that's sort of the call from like local officials. It's not that we don't need more data. I think data is important. I think to the extent that we can measure things consistently over time is really important. One and done analyses are helpful, but they don't provide the kind of sort of performance management lifecycle that we need to be able to continue investments. They get people's attention, right? Like, oh, this is a problem. But if you want people to actually invest in fixing that problem and keep investing, you've got to demonstrate that you address the issue, and you need data to prove that that worked. So if it's a one and done, then you kind of really can't tell that story in a cohesive way, which is why it's important to, I think, have these kinds of exchanges between people who are doing practice and folks who are doing research to think about, okay, here's the question I need to answer. And don't just answer the question, but give me a way to keep answering the question over time.
Okay, well, thank you. Thank you very much. Thank you, Rodrigo, Katie, Rainer, Avi. Thank you for all your comments and your time. And thank you all for being patiently in the audience. No very tough questions, but tough discussion. Thank you. Thank you very much to everyone.
Okay, so we are closing. Was the last